Thanks, Steve. I'm actually the third place in this. My son's a commissioner. They asked him to do it. He had another meeting. My daughter-in-law's the mayor. She had another meeting. So they asked me if I'd do it, and I said, well, I might as well do it. So on behalf of the town of Grantsville and Garrett County as a whole, I want to welcome you here today. Welcome you to winter. Those of you who haven't been here, we're back into winter here. And a lot of times I speak to people, and I'm not going to take a whole lot of your time. I do a quiz. So I'm going to do a quiz with you all. An old gentleman one time told me there's only 1 month that's never snowed in Garrett County. So I'd ask you to think about that, and I'll get back to that in a second. I can't speak enough about the Grantsville Fire Department. You see what they did here, and this is not a large company. This is input from a lot of different organizations to help them get this completed. Now they can do a lot of functions here. This is a place where if 68 gets blocked off, people can't travel, they can come here and spend time here till everything's in place. The fire company here keeps very busy, mainly because of 68. I mean, I've sat at the house, which is down there a little ways, and I know sometimes during the day they get called out 3-4 times a day. And they do have some young people coming in, which is great, and they're just a tremendous part of the town. Now, Grantsville's poised, you come back the next time, whatever that might be. We're working on 2 major housing projects here, one down here and one over there. So town's going to grow. A lot of things going on in the business park out here. So come back when you can spend a little more time and see what all we do have here. So with that, again, welcome. If I can ever be of any help to you, I used to say, look me up in the phone book, but they don't make them anymore, so you can't look me up in the phone book. Now I'll get back to my quiz. How many of you think it's June? 1. How many think July? 2. August? Looks like August wins out. I did this one time, and some guy sitting in the back who was a DNR officer for like 30 years up here or something like that, he said, hey, you're wrong. You're wrong. The guy told me it was August. And he said, nope. He said, I was out on P Ridge. He named the date and what he was doing, and he said it snowed. I said, well, that shoots out there. It snows every month in Garrett County. But don't worry. We got the best snow crews in the world. We'll get you in and we'll get you out. Have a good time. Spend a good time here. Good luck to all of you. I've worked with a lot of you in Annapolis when I was there. Matter of fact, my staff scheduled your room for your get-together down there for the 16 years I was in the Senate. And we enjoyed doing that. And I know you all had a good turnouts at that, and I appreciate working with a lot of you on issues. So again, keep up the good work. Again, if I can help you, let me know. Thank you very much.
Thank you, sir. And Chip, I'll turn it back to you.
Okay, thank you, and thank you to Grantsville. And when I walked in the door, Chief Smith says, "You're Chip Jewell, right?" He was in communications up here when I was in communications, so goes back a little ways to our old center. So great to see you, Steve. Okay. Second Vice President Charlie Simpson, would you like to introduce our guest, please?
I got to bring it down a little bit. It's sensitive, but okay. Thank you, Mr. Chairman. Willis, today it's a good day for, I guess, everybody to get out. We've got a good group of guests and officers and all in attendance. Have President Eric Smothers, First Vice President Skip Carey, Second Vice President, myself, our Secretary, Doyle Cox. We have our Financial Secretary, Mitch Vogt. We have our Chief Chaplain, John Long. The trustees, we have our Trustee Chairman, Doug Alexander. We have Trustee Robbie Blackston. We have our Attorney, Mike Farlow. And Parliamentarian Ken Bush. Past presidents. Past President 2022-2023, Ben Kurtz. 2021-2022, Joel McCrae. 2017 to 2018, Mark Bilger. 2012-2013, John Denver. 2010-2011, Doyle Cox. From 2002 to 2003, Gene Worthington. 2000 to 2001, Roger Stager. From 1996 to 1997, Stephen Cox. Our senior past president present is Robert P. Cumberland, 1987-1988. Members of the executive committee present, Chairman Chip Jewell, Vice Chair Roger Stager, past president, Mark Bilger, past president, Bill Faust, Ron Block, Steve Cox, past president, Bob Phillips, Tim Dayton, Lee Lutz, Randy Smith, Buddy Sutton, Ben Kurtz, past president. We have our executive director, Kate Lovelace, and assistant, Lynn Hawkins. From our auxiliary, we have President Gene Main and Junior Vice President Joan Kramer. I believe that covers everybody, Mr. Chairman.
Thank you, Mr. Second Vice President. Okay, at this time, are there any individuals who have never been to an MSFA Executive Committee meeting? Any new members that are here for the very first time? We'd certainly like to welcome you and introduce you. Seeing or hearing none, it's up to us to go out and recruit people. This is called the Gene Worthington method. Gene started this back when he was president, and I think it's a great idea that we encourage new people here. When they do arrive, we welcome them and acknowledge them as being a part of our service. Okay, officers report. President Smothers.
Well, good morning again, and I've uploaded my report, but I don't see it yet, so I'll give you some of the highlights. One, we're in the process of getting geared up for Ocean City, so all that is in the works. So I know we'll see a good many of you folks there as we get ready and get geared up for that. So we're in high swing for that. As I said in the beginning, this is my last executive board meeting, and I really want to take the time to not only thank Chip again as being the chair, but also the executive board members who stepped up and took a willingness to sit in their prospective regions and counties around the state, as well as our members for our committees, our chairmen and women. We have a lot of moving parts that go along with us. And I also want to say thank you to the MSFA partners. The partnership that we have within MSP or MSFA really makes us work. And I think that really showed this year in Annapolis. I'm not going to steal Bob's thunder, but Sine Die is coming up on Monday, and a lot of the initiatives that we have asked for are going to be moving forward. MEMSOF, that's going to be secure for the next couple of years. We were able to get the light bill for our fire police approved here within the last couple of days. A lot of cancer initiatives and things that were supportive of our fire service. So we're moving in the right direction, and I really have to say thank you to the legislative group and Chief Phillips for making that work, and Teresa with the fire marshals meetings during the weekend or during the Fridays, and really kept everybody informed and everybody was engaged. And first time in many years we are going to have a successful outcome And I really have to thank our legislators this year for the hard work, and being engaging with us in Annapolis. So a lot more to come, as you'll hear from Chief Phillips when he gets to the legislative report. So as we're moving forward, we'll talk a little bit about some of the changes that are coming up in EMS. That's going to be a hot topic, I think, today. Just know that MSFA is fully engaged in the process of the changes. I know folks keep trying to finger point of different items, and I don't want to get into that right now. But know that we're working to try to make it better for our providers and not harder. Our recruitment and retention efforts are paying off across the state. As I've traveled around and spoken to many department members, the word's kind of getting out, which is a good thing. We still need to be responsive to the departments, and I think we're doing a good job there, especially with our SAFER grant. That also is very, very helpful. We have money. I know some of our budget guys don't like hear me say that, but we have money in our SAFER grant that will allow you to advertise your department. Last year we gave over 65 tents to different departments across the state of Maryland. I think this year we're up to 22 or 25 so far. I'd like to see if we can make that again another 65 departments to really highlight who you are and what you do when you're out here doing public events and stuff, and that's how we get. But we also have to have our chiefs of the departments, our presidents of the department being engaged there too. One of the things I have not gotten to yet this year is to kind of have an open forum with the chiefs and presidents, but my vice presidents know that's an item that needs to be addressed. So if I don't get it completed, I'm certainly sure these two gentlemen will come next year or toward the end of the year. So we still have time. So we're looking at trying to address that. So we want to just hear the issues that folks are having to see how we can continue to be helpful. One of the things I think we really need to pay attention to is the OSHA regulation standards coming. You're going to hear a lot about that too. That could be very devastating to not only the departments here in Maryland, but across this country. Depending on what they do and how those regulations pan out, that could really close about 97% of the fire departments, career and volunteer, across the United States. That's how, when that comes into law, you'd have to follow the letter of the law to those. And I can tell you that MSFA is fully engaged with those discussions. We've had almost bi-weekly discussions with OSH and MOSH here in Maryland. And I get it. They want to mitigate the fire deaths that we've had across the state. But at what cost? We're already following a lot of the NFPA regulations and guidelines, and our men and women across the state are doing an excellent job. But that means, as, for example, if you were a county fire department, OSHA might come out and give you a citation. But if you're an independent fire department like Grantsville or Brunswick Ambulance Rescue or Pittsville, not only would you get the citation, but you would get a fine with that. How many fines would a department be able to get before, they have to close their doors? And we're trying to prevent that. They would also look at your training. They would also look at if folks are doing physicals on a biannual or annual basis. So there's a lot of moving parts, and I really think that folks really need to pay attention to that going forward. And I can tell you that we are very much engaged with that. So with that, I'll leave it go with that. You can see my report online, because a lot of these topics will get brought up today, so I don't really want to get into them on standing up here. But again, thank you for your help and support over my term. Thank you, Mr. Chair.
My report's filed electronically. It's a very limited report this time. I spent most of the time since Pocomoke and getting my knee, getting a new knee, and then getting it to work well. But everything's working well now, so we're starting back. Like the President said, the last 2 years I've been very fortunate. I've worked under Ben, now I'm working under Eric. They've been great educators. They've taught me a lot about what to do, how to do, plus all of my other friends here. There's a lot to be done. And this organization is one of the unique organizations in the fact that even though we are so spread out and so diversified, we work together to accomplish something for the good of the citizens of the state of Maryland. And that's unique. But that can't be done without you all. Because the Maryland State Firemen's Association is not these gentlemen sitting up here, nor us three here, nor the ladies. It's you. It's the individual companies and the members in the individual companies. And that's what makes it work. That's what makes it great. I beg you to continue this work next year when I hopefully in June will be elected president. I have found out since Westminster that I am running for president, not vice president or not guard in the ladies auxiliary, but actually president. So I solicit your vote. I look forward to working with Charlie, and I hope with the gentleman sitting out in the audience is going to announce that he's running today for us to achieve what Eric has started, following what Ben started, and following every past president that's been named here on down. It's a pleasure to be here. It's a pleasure to work for you. The last 2 years have been a tremendous education, but most importantly, they have been a great time and a good friendship. Thank you.
Thank you, Mr. First Vice President. Second Vice President, and if you would, sir, I believe you missed the introduction of the partners. While you're up there, please.
Do want to add our partners that are in attendance today and introduce those. We have with us Director Michael Cox from the Maryland Fire Rescue Institute. We have Dr. Theodore Delbridge from the Maryland Institute for Emergency Medical Services. Also, we have with us from the DNR Forestry Service, Chris Robertson. And from MDEM, we have Tom Brown, the regional representative. So Mr. Chairman and members of the Executive Committee all, my report is filed electronically and has been submitted previously. But I first want to thank everybody that has assisted me and provided support during my medical issues. I think particularly one of the big things that's been a big advantage is our past president, vice chair of the Executive Committee, Roger Steger, and our first vice president offered me their can of WD-40 that they've been using for the past month and a half with their knee surgeries. Fortunately, my hip is being replaced Wednesday, supposedly, and I think I should be back in all good order soon after that. So thank all those that have given me the assistance. One of the big things is that I've learned this year in following both Eric and our first vice president, the amount of activity, the amount of work that goes on within this association. I've been involved in various areas of the association for, I guess, 40 years. And it's unbelievable. I find I'm still learning. And Chief Phillips, wow, you know, what a group you have with that legislative group this year. Fantastic work, and so much. But not just that committee, but every committee that we have and the amount of work that our officers do. It's absolutely fantastic. One of the big things that I'm going to push, I do push, is our going out and telling the public who we are. We're volunteers. We do this for nothing, right? That's what we do it because we want to. We like to go out and help people. And I think we need to make a bigger effort in getting that information out there. I see that in many cases that information is being passed on by our career departments and so on like that, of what they do. But fairly often you don't see anything that relates to the volunteers. And I think we need to get the public back on board. They've had a couple years where they didn't see us, not as much as they should have. They didn't hear about us. And I think the big thing is let's get the volunteer word back out. So that's what I have to say. It's been a pleasure working with these gentlemen, working with everybody here to this point, and I hope to continue my travels with this association on board and moving forward. So thank you all very much.
Thank you, Charlie, and our thoughts will be with you and hopefully successful surgery. The Executive Director's report, Kate.
Chairman Jewell, members of the committee and guests, good morning. Greetings to all from the Crofton office staff. I have obviously with me Lynn Hawkins, for those in the audience who, you all know who she is, but we also have the Western Maryland Regional Safer Coordinator, Nicole Stoudemire, is also here with us today. If you have any questions on anything for Safer that's been going on in Western Maryland, she will be here through lunch today, so feel free to stop by and have a chat with Nicole. The past 2 months have been busy ones as we work through Safer projects, numerous convention updates, activities, committee meetings, trainings, and travel. Thought somebody called me, sorry. My report has been filed electronically. I'll just highlight some of the pieces on here. The weekly reports, I hope everyone is receiving the weekly reports. If not, or if you'd like to add other individuals to receive them, please let me know, put you on the email. We feel that it's useful. We're hoping it's getting down to the people that need to see it. So your help with disseminating that information to your county and department contacts is greatly appreciated. If you have anything to add to the report, please let me know by the Thursday of each week. For Safer has been moving steadily along. The website refresh is just around the corner. When reviewing the pieces of the contents of the websites, they were tasked with a huge ask. They had to go in and organize all of the data and all the content that's been put on that website for the past 6 years. There was an overwhelming amount of redundant content and content that was updated in certain sections and not updated in other sections, so it's been a little bit of a tedious process to get that all up and organized. I did send some links to share to the IT team this past week, so they are in the process of looking over some of those links to make sure things are progressing along as expected. I've also reviewed and sent over any necessary R&R changes to Chairman Dayton, so he's also going to be looking at those to make sure that those are up to what he expects for his recruitment and retention pieces on the MarylandVolunteer.org website as well. The RRO class is moving along. We did have the first one in Maryland, Southern Maryland, at La Plata. It was not well attended. We were a little disappointed with the numbers that proved out for that particular class. We know we were competing with the Fire and Life Safety Conference, so we're hoping that the other offerings will be more well attended. The limit is 24 people per class. The whole point of that is to have a more intimate learning experience rather than just having a whole big group of people, and it's going to be strategically curtailed to each region, so that's the whole point of having a smaller class. The next one is next weekend out here in Allegheny. We would like, hopefully, some more attendees, or it will be subject to be rescheduled, because there is a certain amount that we need to at least have in the class for the instructors to come out to provide the training. So if there's people out in West Maryland that want to attend the training, please let Nicole know. We do have the flyers over at the desk, and if you have any if you need any assistance registering, please let us know. In the report, I've listed the remaining classes that we are offering: Northeastern, Upper Eastern Shore, Lower Eastern Shore, the Northern region up in Frederick County, and as well as the Mid-region in Miffrey College Park. Please encourage your members to attend, even if their recruitment efforts are being successful. Have them come, have them network with the people that are there, share their success stories, and hopefully we'll have some successful and full classes the remaining of the year. President Smothers touched on the event marketing materials. We have 36 departments now out of the second round of 65 that have signed up to take part in this program. The items are very good quality. People have been sharing their setups that as they've received them on social medias, and I think the program's been going along very well. We will probably have a third round because it's been so successful. This one particularly runs through April 15th. We will extend to the 30th if there's a few that still need to get some orders in. Please be reminded that the contact information for your MarylandVolunteer.org profile must be confirmed before you get the shopping link, so please don't order through the vendor directly without doing that first. The whole point is that we're updating our database for recruitment and retention so that we can push information out to all of the recruiters that are on those profiles. And if there are no profiles for that department, they will be asked to create one in order to participate in the program.
No, and what Kate just said about the departments, because that comes back to MarylandVolunteer.org. I'm going to jump here for 2 seconds. We're trying to help the departments. So the very first class we had 6 people, 6 departments. We're investing a lot of money in SAFER to help folks do recruitment and retention. So it shouldn't be very hard to have people send at least one person, even if they're not the recruiter, to one of these trainings in the areas that they're in. We have enough of them. So, we're investing money in you, just like we're doing for the tents and stuff. So we can only do so much. It really comes back to the departments at their level to be willing to help themselves. So the money and time invested here to try to help departments, they've got to take ownership of what they do sometimes, especially the MarylandVolunteer.org. We've asked folks to update their company websites. So in order to get the tent from us, you need to make sure that the links work for your home department or you don't get the tent. So it's kind of like quid pro quo. We need a little something from you in order to get something from us. And that's the way that's going to work. So if you're not updated, you will not get the tent. So make sure that your stuff is up to date. So I would ask the executive board members to take that back home to their departments to make sure that that's taken care of.
Thank you. Well, we've been pretty successful with getting the MarylandVolunteer.org profiles up to date and corrected. We've probably done about, I would say, 30 to 40% of the profiles that have been needing changes. And a lot of the departments actually didn't know they had a profile, so it was nice for them to be able to go in and see what they had and look at the information and update it and make sure that those leads are going to the correct individuals. Roadside marketing, we've contracted a second round of the regional roadside marketing. The one that has been out on the western portion of the state will be wrapping up this week. I said that it started last week, but when I went back through my notes, that one is wrapping up this week. The second round of 10 locations on the Eastern Shore actually starts on Monday. We did see, I believe it was a 12% increase in leads having those roadside marketing up, so we're going to look and see if we're comparable to that for this round, or if it's a little less, then we might not revisit that for next year. The CTE and cadet materials, we've had a couple of additional departments reach out to participate in receiving that free material. I'd like to thank the staff at Miffrey College Park. They've been the ones that basically have been going in and creating the materials for the departments and working with them directly to get their items updated. Travel reimbursements, we are going to be utilizing SAFER funds this year to provide an opportunity for up to 10 individuals to apply for travel reimbursements to attend the IAFC VCOS Symposium in the Sun in November. So more to come on that. We'll send out a link to register. There'll be certain criteria that the individual will have to meet, and as far as after after, like an action item report afterwards that they'll have to submit once they return to get reimbursed. We may extend this to FDIC in Indianapolis in April as well, so depending on what the turnout is for VCAS, and we'll see if we're gonna offer another travel stipend in the beginning of next year. The rest of my report is all conventions, so I'll wait until tomorrow unless anybody has anything specific. Any questions regarding the first part of the report? Past President Bilger.
But, I guess it has to do a little with your report, but the association's a 501c3, but I don't see anything about that on our website promoting that we are a 501c3, and if people were to donate to us, it would be a tax write-off for them. So I don't know if it's something that you or the marketing or the attorney could do something with the website to identify our tax status and again promote that we are that. And then the other thing is every year the state of Maryland does a Maryland charity campaign, and we would be able to get money donated by state employees if we were on the rolls as a member of the charity campaign. So again, I would suggest or make the recommendation that we look into filling out the paperwork and becoming part of that group. So again, we can receive donations from employees in Maryland. That's all I have, Mr. Chairman.
Okay, so I'll get with Attorney Farlow and see what verbiage we have to put up on the website and make sure that that's, or we ask the web team to create some kind of donate button, or however that will work. We'll make sure we get that up and running. Any other questions? Any questions for Lynn?
Lynn, you have anything? You're still talking. Okay.
Okay,
Thank
thank
you all
you so
very
much.
Secretary's report. Vice President, Secretary Doyle.
Thank you, Mr. Chairman. My report was sent electronically and should be on file. Just to bring you up to date, as far as the credentials, at the present time we have a total of 251 companies that have submitted their credentials. And as you see in my report, with the volunteers responded and non-volunteers, I give you some numbers and the total volunteers, but that is incorrect because I've received additional reports since this was printed, and that'll be updated as we go down the road. Just a reminder, when you're talking to your companies out there that have not submitted their reports, the delegate and the alternate can only serve one company. I've had several companies submit the credentials, and sure enough, same member is serving on 2 different companies or 3 different companies. Now, I've sent letters to these and requesting that they correct this. If they do not, when we go to Ocean City for the the Sunday morning executive committee meeting, I'm going to ask that those companies be suspended or placed on where they cannot vote. Then after the election is over with, then they can do this. So until it's corrected, and Chip, you got a question on your mind.
All right, are you saying the company cannot vote or that individual cannot vote? That's a big difference.
I've sent a letter to the company and the individual indicating that they cannot serve as a delegate on 2 different companies' credentials. They need to make the correction, resubmit it, so they're going to have it on file that they only represent one company.
Okay, but come for voting, if that's not the individual that votes,
Yeah, but that throws the, if you look at it, that throws the whole company in jeopardy. If they get two members, or rather, if they have a member that's serving on two different companies.
Right,
Give one
it's
vote
5
for each.
votes.
Right.
So we would still, so they would not vote at all. They wouldn't get 4 votes. They wouldn't vote at all.
That would be my opinion on it. And that would be up to the attorney or parliamentarian to.
Okay, we'll discuss with the parliamentarian attorney. 'Cause I see the issue. I'm just not sure. If
Right,
the
in the
solution-
past, this
yeah.
is what we've done.
Okay.
Right, so, anyway. And I hope to have it corrected. Some of them have corrected so far, but I've got others out there that they're holding. The first mail out has been completed. Each department received a mail out, plus each one of you received an electronic copy of the convention information, awards information. So there'll be another mail out coming out, which should be completed by the 28th of this month. And this will be the information on the voting, the 2 changes to the bylaws. Just a reminder, I believe the president talked about this, was that the recognition of companies, 75, 100, 150th, so on. If you know of a company, please get it to us in advance so that the proper recognition can be prepared and presented. I know I have on the desk right now information for one, I think it's in September, coming up, so committee chairs. Yeah, submit your reports electronically. The directory. We're starting to work on the directory for next year. If your name has changed, your email address, your phone number, your address, or whatever has changed from this year's directory, please stop by the secretary's desk and make the corrections and copy it back there if you know of any changes in it.
Doyle, for the committee reports for the convention program book, they still come to you?
No, they go
Okay.
directly to Jenny Wilhite.
Okay, just want to make sure.
Right. Okay, any other questions? If not,
None?
that is my report.
Do we have any minutes to approve?
No, they will be prepared and
Ocean
ready to
City.
go for Ocean City.
Ocean City, very good.
Right.
Any other questions for the secretary? Thank you, Doyle.
Report back to us. Jeff Clements, our vice chairman, is working on getting our past files on the server. He's preparing in some way. I didn't get to talk to him extensively about what he has in progress, but he is working on that progress. And our secretary, Tommy Mattingly, is working on the computer that we have now to try to get it lined up and ready to go. Fortunately, there's been little activity for the trustees over the last couple of months. We did initiate contact with the legislative folks in Annapolis, reference to House Bill 1389. In its original form, it did not affect the trustees in any way, or the funding. However, with the proposed amendments that were offered in the Appropriations Committee hearings, if passed, would have placed a tremendous burden on the trustees and our funding. The trustees, number one, are not trained investigators. Number two, we have no medical professionals to consult, and our funding would not have lasted more than about 1.5 to 2 years in its current state. If all these PTSD cases were thrown upon us for line of duty injuries or line of duty death, for us to investigate and mitigate, we would be out of business. Like I said, we're not trained or funded to handle these cases. The original proposed bill placed all the claims in the annotated code in the hands of the Department of Public Safety and Corrections under Section 1202 of the annotated code. The proposed amendments prepared by the Department of Legislative Services added on the MSFA 7-202 as one who will pay, I quote, benefits to the mentally or physically incapacitated members. If the injury is likely to be permanent, the member should be retired, which means we would have to make a monthly payment to those folks from the treasury of the Maryland State Firemen Association. Fortunately, this bill never got out of committee and is done and over with, and I'd like to thank Chairman Phillips, who jumped right on this when we fired an email down to him. He got to the delegate and I think got straightened it up because obviously it didn't go anywhere. So again, Bob, we really thank you for your diligence on that. That's about it for the executive committee. We certainly thank the officers and the executive committee for their support this year. Fortunately, we've had a little bit of a slow year, thank goodness. Knock on wood somewhere, somebody. And we're looking forward to moving forward in the future next year.
Doug, on the appeals board, I know we had that several years ago. Is that something that gets appointed every year, or is that something that was appointed as needed? And wasn't the appointment by positions, not by people?
In most cases, it was then. That thing has never really been written out. That was thrown together when we had those 2 appeals fired at us, about 3, 4, 5 years ago, whatever it was.
I remember.
And we were supposed to have, like you said, positions were supposed to be lined
Right.
up. Never happened.
So that has not been done?
Yeah,
Okay.
it never has happened.
Thank
So,
you.
that's something we need to probably think about and get working, by convention, or maybe right after the convention, have our new committees ready to go.
Okay, and congratulate you and the committee for all the work this past year. I know a lot of positive movement, bringing things up to date, accuracy, making sure that things were available and data available. Congratulations to you and the committee for a very successful year, and thank you for your many years of service on the committee, Doug. I know you'll be stepping down this year. Certainly, as a personal friend, I thank you for that, but what you've done for the MSFA and the trustees in service is commendable, so thank you for your service.
Thank you. Also, I'd like to realize that, thank you. Also like to recognize Robbie Blackston's here. He's the other trustee that was available today. Teresa Collins, as most of you know, Patty Thompson has been in the hospital with a re-diagnosis of cancer, and Teresa couldn't make it today. They just got Patty out to a care facility yesterday, so she couldn't make it today. Tommy Mattingly is tied up with, he's getting ready to leave for vacation in Mexico. So he didn't want to make the trip clean out here. He said he'd rather go to Mexico. So, and then he's got to go to FDIC. Yeah, you're right. Yeah, that's what he said. He didn't want to take a chance of snow. So, but yeah, all that's, Robbie's here. We'll be here at least ways till lunchtime if anybody has any questions or anything they'd like to do. Thank you.
Thank you, Doug. Attorney's report, and be followed by parliamentarian, I believe. Oh, I'm sorry, Kate.
No, sorry, Mr. Chairman. Is this on? I can't tell. Can't hear. It's on already? I don't know. Hello? Is that better? Okay. Oh, I also wanted to just mention that we do have Stephen Jenkins here, who is our Safer Marketing Coordinator. So he will be going around taking pictures if you see him kind of going around and doing his thing. Just wanted to make sure everybody knew that Stephen was here. Thank you for being here, Stephen.
Thank you, Stephen. Mr. Farlow.
Good morning, and in reference to the senator's comments earlier about there being snow in Garrett County, every month of the year I come from Worcester County, where there can be entire years where we go without snow. So it's nice to see some of the white stuff on the ground and have a chance to actually drive in it for a change. I have provided Kate with the information, the language that past President Bilger requested for the 501c3 status to put on the web page. Kate has indicated that she's going to ask the web team to put a donate button on, and the receipt will go out to anybody that donates so that they've got that for their records so that they can have that contribution there. That may bring in some good money. It's a great suggestion. Other than that, yeah. Other than that, I just want to point out there's been a slight uptick in the number of people requesting wills from the Wills for Heroes program. Those wills, last I knew, were available on the webpage so that people can just download those. But if folks get in contact with me, I send them a packet with a fillable will. They can just fill in the blanks as well as powers of attorney. So it's a great program. Just mention it to the members and have them get in touch with me or get those forms off of the webpage so that they can get those. Other than that, it's been fairly quiet on my end the past couple of months. Any questions?
Any questions for the attorney?
Thank you.
Thank you, Mike. Parliamentarian, and I believe you're also going to do the fire marshal's report, Ken? Okay, that's good because that's the very next thing. So after that, we'll have the State Fire Prevention Commission.
Good
Mr. Chairman, members of the Executive Committee, for the parliamentary report, unlike Richard Brooks, I have nothing to say. So I have no formal report to provide other than be here to provide assistance as needed on issues that may come up. So no formal report that way. But as far as the transitioning over to the Fire Marshal's report, which is next on the agenda, I'm here to report this morning on behalf of Acting State Fire Marshal Jason Mowbray to provide the Fire Marshal's report for this meeting. The report was filed electronically, so you all should have copies of that available to you, but I'd like to highlight a couple of points as we go through the report. Number one is that you notice the fire fatalities reports have been filed for calendar year 2023, and there have been 59 confirmed fatalities associated with fire in residential structures, 12 associated with vehicle fires, and 10 in other settings for 81 confirmed fire deaths across the state. That number's been up recently, and we're working on trying to correct that. Currently, there are 3 fire deaths in the state which have been confirmed by the medical examiner's office, and there are also 3, which is a change to report, 3 pending deaths which have been reported to the medical examiner's office waiting final confirmation. You can go to the breakdown of the list by counties for the fire fatalities in both 2023 and 2024, which were included as a part of that report. There's also details on page 2 of a fire that occurred as a fatality in Quantico, which is in Oconto County, that involved a vehicle fire. And like I said, the details about that fire as far as the cause and origin are included in the report. On to the stats for calendar year 2024. They are listed as part of that report as well.
Excuse me just a second. Just hold it down a little bit, please. Thank you.
The calendar year 2024 stats are included as a part of the report as well. So I invite you to review those on page 3 of the report. Some significant incidents that we've been involved in as the State Fire Marshal's Office is that the Underwater Hazardous Device Team was requested to assist with the rescue and recovery efforts as a part of the Francis Scott Key Bridge collapse. That unit spent several days assisting with their boat, their divers, their dive command unit, and a remote operated underwater vehicle. So that was a significant incident that we participated as the State Fire Marshal's Office. There's also details in the report of an accident that occurred with one of our deputies who was returning home from duty that day, and you can view that information that occurred in Washington County on March 22nd. On March 17th, the State Fire Marshal's Office retired one of the accelerant detection canines at Sky after 7 years of service to the state. And Senior Deputy State Fire Marshal Decker and Sky traveled regularly to Federal Law Enforcement Training Center in Glencoe, Georgia, where they assisted in training ATF agents during their academy. So the Senior Deputy State Fire Marshal Decker of the Southern Regional Office is currently in training for the ATF National Canine Division in Front Royal, Virginia, for 6 weeks to work with a new partner. And when the pair graduates, they will return to Maryland and be one of only 71 teams in the entire United States. On kind of a personnel note, on Wednesday, March 13th, 2024, retired State Fire Marshal Rocco Gabriel passed away after experiencing some recent hospitalizations and health conditions. And we appreciate the participation of this organization and members of this organization in recognizing past Fire Marshal Gabriel's contributions to the State Fire Marshal's Office and also to the citizens of Maryland. If you read the information as a part of the report, you can see some significant contributions that he made during his time as State Fire Marshal, which was nearly 19 years, which is the longest serving State Fire Marshal in the state of Maryland, and ranks nationally as one of the highest and longest serving Fire Marshals. I had the pleasure and honor of serving with Fire Marshal Gabriel during his entire tenure as State Fire Marshal in Maryland. So that information is included as a part of the report. I
would say that as under personnel efforts, the State Fire Marshal's Office has conducted online applicant orientations for those who are interested in pursuing a career as a Deputy State Fire Marshal. The orientation is the first step of that hiring process, and applicants have completed a functional fitness test and written test on March 22nd. An interview will be scheduled for those who pass both of those tests in the near future. And there's one current vacancy for the State Fire Marshal's Office to fill. Some other events that we participate in as the Fire Marshal's Office is that, once again, the Underwater Hazardous Device Team supported the Maryland Special Olympics with divers at 2 events, both at the Deep Creek Dunk and at the Polar Bear Plunge at Sandy Point State Park. And those details are included in the report. Without stealing too much thunder from the report given by Chief Phillips in the legislative session, there are a couple of pieces of legislation that we've been monitoring pretty closely, although there's no departmental bills that we have in for this particular session. But some of the issues that we've been following are House Bill 321, which is the criminal law and crimes of arson. And that's for an enhancement of charges for arson fires resulting in injuries to firefighters. That passed the first reading in the Senate. That's where it currently stands. And so it's passed over from the House over to the Senate. House Bills 468, Companion Bill 7, Senate Bill 532 is a commission to advance lithium-ion battery safety. And that both has passed over to both houses, has had the first reading in the Senate, and passed both chambers as a Senate bill. House Bill 502, Public Safety, Fire Dampers and Smoke Dampers, is not cleared committee. House Bill 503, which is the CSST tubing for fuel gas piping. Both of those bills, the Companion Bill 7, Senate Bill 586, they have not passed the committee, not cleared committees. The Senate Bill 689, which is the Melanie Diaz Fire Safety Act, has passed over and has gone to the governor for signature. That's the House bill side. House Bill 823 has passed by the governor, which requires certain upgrades to fire protection features for high-rise buildings, including smoke detection systems and warnings to residents and occupants of those buildings. House Bill 1403, which would have changed the ages for children which were permitted in daycare, did not receive a favorable report, so it is not cleared committee. And there's also another Senate Bill 352 to watch very carefully, which was actually withdrawn by the sponsor. But what that bill was intending to do was increase the heights which would be permitted for apartment buildings beyond what the model codes would allow. And this is a trend we're seeing across the country, and a lot of the fire marshals organizations are taking exception to that, following opposition statements, so it's something we'll probably have to closely watch in the future as to what direction that may take. But we have some very severe concerns about allowing these buildings to be built taller than what the model codes would permit, even with protection built into the building. I will say that the appointment process for the new state fire marshal, as well as the updates for the State Fire Prevention Code to update to the 2024 model codes, are both in the hands of the State Fire Prevention Commission. So I'll leave further details to report from that organization. And other than that, this completes the report that I have for the State Fire Marshal's Office, and we're pleased to report you with all this updated information. We thank you for your dedication and hard work in making Maryland fire safe. I look forward to working with you as a partner in this effort. With that, I'll take any questions. Thank you.
Question, Ken, do you know, is the crowd control class, is that available through the fire marshal's office? Apparently the temporary liquor licenses are now requiring people to have the crowd control certification.
That is available through the website, but it's through a private organization now.
Okay, it is available. Is there a charge on it?
I think there's a link on our website that you can find.
Okay, I've had some questions about that. Apparently that's being pushed
Right.
through the alcohol. Okay. Any other questions for fire marshal or parliamentarian? Thank you, Ken.
Thank you.
State Fire Prevention Commission will be followed by State Police Aviation.
Thank you, Chairman Joe. I was asked by Chairman Tockelman to provide the following report. The 2024 edition of the State Fire Prevention Code was presented to the Commission at its February meeting. The commission was informed by the senior state police official that as the code included retro fire sprinklers in existing high-rise residential buildings, Colonel Butler would not sign nor forward it for consideration. At that time, the commission tabled the code's adoption, and several commissioners volunteered to meet with the deputy chief of staff to try and work through a compromise. As of our last meeting, there has been a meeting held, but it was not with the superintendent, and at this point, the process is on hold. We meet next week on the 18th, again, to continue discussions about the adoption of a new code. The commission recently completed interviews of applicants for the vacant position of Maryland State Fire Marshal. A list of 3 names have been forwarded to the Colonel for final selection and consideration. I'd also like to recognize Dan Stevens, who serves on the commission with us this year, and former Commissioner Doug Alexander, who served for many years also. That's my report. If there's any questions, I'll be happy to try and answer them.
Any questions for past President Bilger? I know we're all expressing our frustration on this whole fire prevention code adoption, but I think I'm not sure it's worth us to discuss any further than where they're at. Thank you for your involvement in that. Any further questions for past President Bilger? Very good. Maryland State Police Aviation, which will be followed by MIMS.
Good morning, Mr. Chairman. Good morning, committee. Corporal Jacqueline Pickett, in the OIC, Trooper 5, presenting on behalf of the Maryland State Police Aviation Command and on behalf of Major Tagliaferri. It's my honor to give you our report today. Starting off, the state police just recently graduated six trooper medics on April 4th. They'll be completing their field training throughout the state of Maryland via the various barracks. And then they'll be considered for reassignment into the Aviation Command starting the beginning of 2025. We currently have 4 pilots in various stages of training, and we hope to have them out in the fleet starting May of 2024. I currently have our updated blood report for the year. Since May of 2023, we've administered blood to 91 different patients across the state and out of state, to include Delaware and West Virginia. Currently, we've administered 112 units to include 4 units last night on 2 various medevacs. In total, that was 63 units in 2023 and 28 thus far year-to-date 2024. Much like all the other agencies, we've also been a pivotal part in the Francis Scott Key incident. Within minutes of the initial request, we had 2 troopers up in the air, Trooper 1 and Trooper 6, conducting various search missions for the missing individuals. We've also currently been staffing the incident command post, the air branch coordinator controlling the TFR, and controlling all manned and unmanned air assets that enter the restricted flight area. Other than that, we just have aircraft in various stages of maintenance, currently still staffing a fleet of 7 aircraft, a total of 10. Other than that, Sir Chairman, if you don't have any questions, I know it's kind of brief, but that's our report.
And the whole blood program's amazing. That's fantastic.
Oh, yes, sir. It's been a
successful.
pivotal game player. Countless lives have been saved. Monumental moment in history for us.
That's great. Congratulations, aviation, and all the cooperative agencies to get that done. It's a
Yes,
real
sir.
tribute to you all.
Thank
Any
you.
other questions for Maryland State Police Aviation? And could you have your name again, Corporal? I'm sorry, your name again for the record, please.
Corporal Jacqueline Pickett.
Jack Pickett.
Yes, sir.
Thank you very much for your time. Thanks
sir.
for coming today.
I wouldn't let her off so easy.
For that, we should have promoted you if you supervised him. I guarantee you. Okay, Dr. Delbridge, and MIMS, please.
So Ted Delbridge from MEMS, good morning. You all take me to places far and wide when we have these meetings, but I will say this is a place I've been to before. We held our Stars of Life and Right Care Winter Council Awards right here last year. The Grantsville Volunteer Fire Department was kind enough to host us. I'll cover a couple things and hope I won't be too redundant. As was mentioned in the legislative report, the MEMSOF received quite an infusion of, or will receive quite an infusion of money over the course of the next several years due to some legislative action. The result is a sizable infusion of capital to the Shock Trauma Center, a significant increase in funds to the Trauma Physician Services Fund, which is managed by the Maryland Healthcare Commission and funds unreimbursed expenses to the trauma centers other than the Shock Trauma Center. And it stabilizes funding for the budgets of MIFRE, State Police Aviation Command, MEMS, and the AMOS funds. And so that's good news. If it goes as predicted, it'll stabilize the MEMSOF outside of 10 years. So we won't have to revisit this topic for a while longer. So that's good. In some other perspective on some other legislative action, there was an extension of the potential for paramedics to administer influenza and COVID-19 vaccines to the public. That would have expired at the end of this calendar year, but it extends down to 2030. There's a evolving prohibition on requiring Social Security numbers for issuing licenses and certificates. This is the result of a federal law that requires Social Security numbers to be obtained, having to do with really people that are trying to avoid child support and other such legal actions against them. But a state can make itself exempt by enacting a state law. That was done for the healthcare occupations last year for nursing and physicians, and this is sort of playing a catch-up. And it most directly involves an EMT applicant from Montgomery County. If y'all can keep it down, I'm trying to talk here. One thing that's going to affect MEMS quite a bit is legislation that will require AEDs in public building facilities to now have naloxone available with the AED. What is a public building is defined in the legislation and doesn't include everything that you might think of as a public place, but definitely includes buildings that are supported with public funds, including like rec centers, parks, where some AEDs are kept outside. There are 17,000 public AEDs in Maryland. And some of them are, the program isn't necessarily, the program of record isn't necessarily where the AED is kept. And so we are going to have to do some super sleuthing to figure out where AEDs actually are, like where the AED is not just where the administrative offices for who's keeping track of the AEDs is. And get naloxone to those places. Naloxone has a much shorter shelf life than the component parts of an AED do. So it's going to be quite a bit of work that we'll be undertaking. We have a couple of moving parts, some of which I talked about before when y'all met at Princess Anne. One is paramedic testing, the National Registry, which is the big one, which Maryland requires of all paramedics, is changing its testing strategy and no longer requiring a technical proficiency exam, psychomotor exam. They've changed the quality of the cognitive examination and believe that they adequately test decision-making components, and that the psychomotor parts, the technical skills, ought to be verified by the educational program where a paramedic is getting spooled up. That changes on July 1st. We will abandon psychomotor testing along with the National Register requirement. The job of MEMS then becomes to ensure that educational programs of paramedics are adequately managing paramedic student portfolios, which describes their technical proficiency as they progress through school. And so we sort of change gears in the focus a little bit. We've been working on the EMT certification exam to make sure that it is valid, measuring what we hope to measuring, reliable, making that when a student takes the test, they get the same result time after time after time if they do the same things, and that it's fair. And so there isn't a bias toward or against a particular student or educational program or things like that. We're still refining that. The EMS medical director, Dr. Chismar, designed all the scenarios. Some of them are a little complicated probably for an entry-level EMT. And so we're working on modifying those and monitoring those circumstances. Everybody that's tried to take the psychomotor examination has eventually passed over the course of the last 9-month pilot project, but some people are requiring more than one effort, and we're trying to make sure the test is valid, reliable, and fair. That's our emphasis. And finally, the last time y'all met, I talked about the evolving strategy regarding EMT recertification. Let me describe for you quickly how that requirement lives. The requirements for EMT certification, along with EMR and paramedic and CRT, all exist in the COMAR regulations. In order to make a new regulation, first somebody had to draft it. That was done. The board approved, the EMS board approves it. That was done last fall. Then it goes for legislative review, which is really about making sure the lingo is right, the text is in the right format, and that it doesn't violate any law. That was done. That approval came a couple months ago. Then MEMS really has about a year to take the regulation back to the board for a final vote, and after the board votes on it, there's an implementation period of a couple of weeks. In other words, the board can't vote on it and take another year to enact it. Once the board votes, it's got to be good to go. I intentionally have not taken this to the board, even though it's been a couple of months since the legislative review happened, to make sure that we were ready for prime time. And the goal of the regulatory change was really two parts. One was to be able to define the continuing education required for EMTs seeking recertification so that we could adjust it to quality improvement findings over the course of time. So if we realize that there's a need for EMTs to understand more about OBGYN emergencies, we could stipulate that in the next recertification cycle, we want so much of continuing education to be about OBGYN emergencies, or pulmonary emergencies, or cardiac emergencies, or whatever. The current construct of EMT recertification requires about 24 hours of continuing education, and it's divided up. You can get it a lot of different ways, but a lot of people seek a weekend review, 12 hours on one day of didactic stuff and 12 hours on another day of skills verification kind of stuff. One goal was to make sure that the new requirements didn't exceed the current construct of 24 hours. Probably we underestimated what is required for the skills verification part. So the way it's currently designed in regulation is 20 hours of didactic, and the EMT can get that 20 hours lots of different ways. They could go to a course, they could do a lot online. It's really meant to be really super flexible for an EMT to be able to manage their continuing education requirements so that so they do it, and they can get lots of different ways. But the thinking was that the skills verification part would only take a couple hours. That has proven to not be the case. I'm sure Dr. Cox can answer more questions about this, but MIFRI volunteered and after discussions with MIFRI volunteered to have a pilot exercise where we tried to run people through the skills verification thing based on the skills that the EMS medical director wanted to have verified. Yeah, there's no way that happens in 2.5 hours. And if it did happen in 2.5 hours, it would be prohibitively expensive. And so we're still working to see if the current regulation, as it is authored, as it's constructed, can be molded into what we think is required to do the skills verification or technical proficiency, or we need to go back to the drawing board and go again. There are really parts of the new regulation that are important, and one of the things they do is they change the EMT's expiration dates from December 31st and June 30th, which were crunch times of year for people and staff, and no EMT wants to be worried over like winter holidays about recertification kind of stuff. And it made us have to like put people on laps a whole lot more often. It changes it to January 31st and July 31st. And we've been able to do some of that already by a board resolution, but we need to get the regulation to build that. And so there's interest in making the current constructed regulation work, but not work the way we had described it working. We want it to be more malleable and doable, not only by the people, but by the educational programs that are doing the validation. And so, still a work in progress. Our tentative deadline for taking this to the board was in July, so the current people who think they expire June 30th really don't expire until July 31st. They'll do it the way we've been doing up till now. We were hoping to have the next group that would expire January 31st to be living with the new construct, if you will. with an obligation that we would crosswalk at things that people have already done up till now to the new version. And we'll have to do that for 3 years because people have done stuff already that would count for 3 years going out. But if we can't get it done by July 31st, then we just won't. So keep on working. And with that, I'm done talking because I've talked way too long.
Any further questions for Dr. Delbridge? Thank you, Doctor. Okay, EMS board, Eric, or who is he report on that? EMS board.
Our next meeting's Tuesday.
Okay. And then Shop Trial will be next.
Just real quick, our next meeting's Tuesday.
Some SAC didn't meet this month because of the legislative session. EMS board is next Tuesday, so that's where we are with that.
Takes care of EMS board and Sims.
Good morning, Mr. Chair, members of the committee. I did submit a report electronically, and Doyle has some hard copies if you would like. Just wanted to start out with a review of the EMTB numbers for the past couple of years, since there's been a lot of rumblings about that. So this year, FY24, there's been 51 classes that have started in EMT. Only 14 of those classes have tested. Of the 212 students that were in those 14 classes who tested National Registry, the first time pass rate was 66.5%, and after the second attempt it was 75%, both of which are above the national average going forward. And again, that's only the 14 classes of the 51 that have tested so far this year. So if we could look at the FY23 class numbers, there were 550 people who tested for National Registry. So I broke that down in the report into MIFRE stats, what the Maryland stats were, and then National Registry stats. So first attempt, 69% across the board from the national, the state, and MIFRE classes. And then second attempt was 79. And the state has listed that it's an 82% pass rate at National Registry after a third attempt. That number does fall, I will say, when we enter in the high school classes. There's 8 high school classes that have chosen to use the National Registry or take EMT instead of EMR, and those numbers are kind of dismal in those classes, with a 46% pass rate first attempt and a 61% pass rate after the third attempt. Again, they're not, they're MIFRE programs that the high schools use, but they are state high school and county high school programs. We really don't have a say-so in what they do, how they're designed. They just use our programs and information to teach the students in those programs. We do supply instructors for them, but again, that's up to the state. They hand down the rules to the counties for those programs. So, Pearson VUE testing. We just got word last week that thanks to Dr. Delbridge at MIMS for his assistance, our Pearson VUE centers in our regions are closed centers, meaning we don't want to test the steam fitters, the electricians, the beauticians, the barbers, none of that stuff. We put those in place years ago with the assistance from the EMS board and MIMS to be able to test EMT and make that testing part of the EMT programs. We realized years ago, the generation of folks that we're dealing with now, you have to hold them by the hand and take them step by step by step through many processes. So we chose to do closed centers, but when we applied to do the Western Maryland, since all that renovation and everything's done, National Registry and Pearson VUE come back and said, no, you can't do that. You can't be a closed center. You have to test for everything. So I spoke with Dr. Delbridge real quick about it. He made a call to Mr. Seaford from National Registry, and that afternoon we had permission to be a closed center like the rest. So that'll be up and running, and for any of the classes that will test this semester. So While I'm on the subject of the Western Maryland, that capital project is done, and I would like to offer, if anyone, since you all are here for 2 days, wants to go down and see the renovations of the new center, you are more than welcome to do so. That can happen this afternoon, this evening, or what have you. Just let Steve Cox know who wants to go down, and we'll make sure the center's opened up, and the folks can go down and have a look at it since you're up in this end of the state. Few vacancies at Miffrey we're trying to fill. We still got an opening down the Lower Eastern Shore Regional Training Center. Still trying to fill a facilities manager in College Park. We're getting ready to fill for the QA/QI coordinator position and a logistical inventory and equipment manager position. So, instructor recruitment is ongoing, as I've mentioned in all of the meetings. If you're 21 years of age, have 3 years of experience, and you're in good standing with your department or sponsoring agency, please reach out to our recruiters. Or anyone here has any information or questions, they too can reach out to Steve Cox. He can fill them in with any information. MICRB, the next meeting is Wednesday, April 24th. As of the last January meeting, there's some new PDI was approved, and the instructor corps numbers were 780 instructors statewide, 15 instructor trainers statewide, and 264 instructor evaluators statewide. I did want to mention there's going to be a lot of classes that are being revised. Our folks now have been working, and before the end of this fiscal year there will be 16 new classes that are revised. I have a list. I'll leave that with Steve in case anybody wants that instead of going through all them in a sense of time management for you all, but there is a lot. Many have already been done. More importantly, next year 21 classes have to be revised due to the standard changes that Pro Board and has handed down. So I'll give that to Steve. All right, seminars and training that are coming up. We had great success with the Hoagland Seminar, the National Staff and Command Program, the Public Fire and Life Safety Educator Seminar. Next up is Maryland Weekend at the NFA is June 8th and 9th. That was rescheduled when NFA had canceled the February dates. May 4th, there is a lithium-ion battery seminar that we are going to put on in conjunction with UL at the Ridgely Volunteer Fire Department in Caroline County. So please, anybody's interested in doing that, it'll probably be about a 4-hour program. Send your folks down and have them sit through that. It's great information. Dan Madrikowski from UL is going to head that up for us, and always delivers great information. On May 22nd, there's going to be a shipboard firefighting seminar. That'll be held at My Tags in Linthicum, and that is going to be a follow-up to a lot of the shipboard fire awareness program that many of the folks from Baltimore County, I know some folks from Anne Arundel and some of the other surrounding jurisdictions had went through. So multiple speakers for that. That'll be a 6 to 8 hour program again at My Tags. Lunch will be provided for the folks that are attending there at My Tags. We've had such great success with the last couple of Hoagland seminars and the National Staff and Command programs we put on. And of course, the National Staff and Command programs have people that come from all over the country to attend them. We always get great reviews, great marks, and have great speakers. I am considering, I'm playing with our budget now to see if it can be worked out to bring in some of those same speakers, and would like to do a 3-day Maryland Staff and Command program in Annapolis. So maybe do it on a Friday, Saturday, and a Sunday, so that there's ample opportunity for any of the volunteers or career to be able to attend that. But the speakers that are at some of these events are just outstanding, and it's information that needs to be communicated. In my opinion, I think in some respects we've went backwards when it comes to safety in the fire service over the past 10 years. Even though, you know, all the work from the training facilities and academies and agencies and the National Fallen Firefighters and so forth and so on. So, you know, the fire service is just a tough culture to wrestle down and pin down for certain issues. So, but anyway, we're considering that. More to come in the next month or so if we can wrestle that out in our budget. So, you heard me talk at the last couple of meetings about the new instructor certifications. We went through all that last year, broke it out. We finally were able to get the information that had taken effect in the new COMAR regulations on August of 2023. So we finally got the new language. The new books should be out, at least electronically, in the next week or so. We have been reviewing them in-house, making sure there's no issues, and then we'll kick them out to all the agencies, departments, and instructors. So they're aware of that. Instructor skills training.
Director Cox?
The enhanced, yes, sir.
Director Cox, on the, what you just mentioned, the MICRB new language on the Orange books, is that information put out any place that can be reviewed? I see that you're going to have a public comment period in August.
It already went through all that process, and the changes had taken effect in August of 2023, and it was a long, drawn-out process. I mean, we began working on them in 21 and into 22 before they went through the process through the higher education, the Fire and Rescue Education Training Commission, the Higher Education Commission, and down to the law office for the state in Annapolis, and then they went for public comment, and then were finally approved after the public comment periods in August of 2023, Charlie. We just had problems getting the official language from the state, from the Higher Education Commission. But we finally got it taken care of, and the new books have been put together. We're just reviewing them now, and then they'll be kicked out.
Okay, thank you.
Instructor skills training. There'll be an instructor skills enhancement and skills program held in College Park. The enhancement program is April 20th through the 21st. That's where the instructors come in and they go step by step and walk. The instructor candidates come in and they get to work with the instructor for those different skills that they are going to want to be an instructor for, and they'll work with the instructors, instructor trainers, and learn the ins and the outs of that and how things are to be taught. And then they'll come back on May 3rd, 4th, and 5th for the actual skills testing. All right, so the enhancement, April 20th and 21st, and then on May 3rd, 4th, and 5th is when the actual skills will take place. The next professional development for instructors in person will be held in College Park on April 14th. April 14th is the next instructor PDI 6-hour program. All right, we were just notified that from the Office of Legislative Audits that we have just begun our audit at MIFRE for the MSOF. I'm not sure if they're doing the other partners at the same time, but it was time for us to have our audit done, something normal that takes place every couple of years. So Dr. Delbridge already covered the new EMT research program. We're preparing for the convention. I did want to say thanks to Chief Phillips and Eric and all the other members of MSFA and for this legislative session. It truly was outstanding. It was the best one I've seen. Cooperation and interagency coordination to get things done down there this year. So thanks for them for leading the way and taking care of a lot of that. It was an awesome job. And last but not least, OSHA Emergency Response Standard. I know, Mr. Chair, you were there for one of the first meetings, and President Smothers has been there with us, and Executive Committee member Steve Cox has been there as well as myself. And all I can say is what a mess. And every meeting we go to, and the further we get into that, it's just, I mean, crazy. Just the other day at our last meeting, you know, they're having recertification training is shoved into that standard. And some of the standards that have been placed in that document, like for people that have meet the standard for firefighter 1, it's listed in there as 2019. And if you didn't meet that standard or anything after that, not before that, after that, then, you know, you're not going to meet that standard that's there. So I think MOSH has been helpful. They understand that, and we had a lot of stuff scratched out, thrown out the other day. But I will say it's a mess, and it is going to be detrimental, I believe, to both the career and volunteer services in the state combined. I don't know how a career department, if I put my other hat on for a minute, in my past life, will come up with the money to run everybody through recertification training or make everybody go back in and retrain. And same goes for the volunteer force. It's just, it's a mess. So that's all I have. Steve, do you have anything?
Yeah, Mr. Chairman, I want to make it very clear I'm speaking as the Operations Chief, Maryland Fire and Rescue Institute. The letter that was just distributed to the Executive Committee from Baltimore County to the President, in that letter it talks about the EMT curriculum, and it talks about it's not being taught for the National Registry. It is being taught 100% to the National Registry. As a matter of fact, the first portion of the course is everything they need to know so that they can pass the National Registry test. Once they have completed that, then we bring the class back together and we do things and tell them what they need to know so that they can pass the MIMS exam, the practical exam. So wanted to make sure that information was clarified. Also, our planning section has put together a study guide, and we have been monitoring that extremely close. We are finding that the students that use the study guide pass. The students that don't open it up, they fail. We have also monitored on quizzes that if they haven't used the study guide, they're getting 30%, 20%, 40%. Take them back, give them this, make sure they open the study guide. Remarkably, those test scores go up to 85, 90%. So wanted to make sure that information was out.
Yeah, that's also not counting the adaptive testing program we've had in place for years. That is a significant cost to us to put that in place, but that was something extra we did years ago, and it surely improved the numbers. And as you can see, I read earlier, I was unaware of this until just now, but that's wanted to update you all on the numbers that, you know, we're above national averages when it comes to testing and pass rates. So I'll answer any questions.
Is there any further comments, particularly on this particular issue? I know there's been some questions while Director Cox and Dr. Delbridge are here. Mr. President.
No, I think EMS is going to probably bring some up, so I wouldn't go far. So, and same way with Dr. Delbridge, because this is something that we really need to make sure that people understand what they're missing. And they're talking two different things, talking practical and they're talking the written test. The written test is what it is. That ship has sailed, in my opinion. You know, I'm sure we'll address it again at some SAC and the EMS board coming up, but you know, we don't have the money, finances, or resources to write and do our own tests. That's why we went to the National Registry. And Steve just said it, the students that do the online pre-testing and the adaptive testing in Canvas and stuff, those are the folks that are successful. The folks that do not do that and do not do their homework, those are the ones that are failed. We have the materials that we believe will make our providers successful. As I've said before, over the last few years, we will have some providers, regardless of who they are, career or volunteer, that will not have the aptitude to pass the test. I mean, you're going to have a very small percentage of that. But we do the best. I think that if the instructors are paying attention to make sure that the students are doing the online testing and pre-testing, it still comes back to the departments, their chiefs, presidents, and training officers. Once those students get enrolled into an EMT class, they need to follow up with them and make sure that they're doing the homework. We can't do that for you. But somehow that's always MIM's fault, Minfrey's fault, our fault, and then we got to keep chasing this dragon about how bad it is. We're above the national average. I mean, I can't make that any more clear than what we are. You may not pass the first time on the test, but if you follow what the instructors do and go back through the follow-ups the second time, they are pretty successful. So, and we're still with you even if you need that third time. So we're trying to make sure that you have what you need, but it's up to the student and the instructor and the home departments to make sure that they're following up with their folks. I mean, I don't know any other way to put it than that. So, I mean, unless you want the EMS committee or MSFA to do something different, you're going to have to let me know that because we have folks that are sitting on all these boards that can address these issues. But it's the same thing. The practical is different from the written. That needs to be clear too. But, you know, we're in this phase where we're reviewing the practical applications going forward for the new. And yeah, there are hiccups, and we just had one of those issues that we have to address out of a class that had 40 plus students try to go through a practical with 4 evaluators, and it was a hot mess. And we're trying to address those issues, but you're going to have instructors that call in sick, but we need to make sure that they have the resources. And we're not there yet going to the new, because I don't know any academy, including MIFRE, that have all the equipment necessary to pull that off right now. That may be another year away, but we're still trying to make it so that our students are successful. And we're doing test runs. I don't think any one of us here in the room that looked at that first evaluation was happy with what we saw. And I wouldn't put that out in my best day and tag our names to that. But it's a work in progress, and that's what we do before we put something out for the rest of the whole state. So people just need to be clear. The National Registry is one thing. We don't do everything that the National Registry requires here in Maryland. So you still have to revert back to Maryland protocol. We don't do every skill the registry does. We have to teach it, but we don't necessarily have to function to that skill. So, and that's the same for all of our paramedics across the state. We don't do every skill that the National Registry does here in Maryland. It's up to the EMTs. You're lucky. You don't have to maintain your EMT, your National Registry EMT once you get it. The paramedics do. So you have 3 years where the paramedics have 2 years to maintain theirs. So, and we still have folks that can't get that done in 3 years. I don't know why, but we have enough resources and trainings that you shouldn't have to wait till the last minute. So I know the EMS committee probably has some other things that they want to bring up, and you have a letter from Baltimore County in reference to a training that they did, and they lost some career providers. I don't know what that academy, what happened in that academy class. Still trying to get the details of that. But even for the career academies and the colleges that are teaching it, they're going to have issues, but we got to be willing to listen what the issues are and then delve into it and see what those problems are. Both Mike and Steve and Dr. Dillibridge have been very instrumental in trying to dissect what those issues are
and putting the right message out instead of just the hearsay stuff.
Thank you, Mr. President. Any other questions for Mifrey? Director Cox, if you'd be kind enough to stick around for a few minutes, this will be coming, our EMS committee will be coming up after our partner agencies. I see Dr. Delbridge is still here if there's any further questions.
Yes,
Thank
sir.
you,
Thank you, Mr. Chairman.
Anybody representing MDEM? I think I heard somebody here from, there we go, from Western Maryland. Thank you.
Good morning. First of all, Secretary Strickland wanted me to express his regret for not being able to attend today's meeting. He's had some conflicts with the schedule this weekend. Also, just for clarity purposes, I'm aware that the quarterly report from MDEM was not submitted online. I do not have copies either. However, I have had discussions with some senior leadership. I am prepared to provide you with some information from MDEM today. My name is Tom Brown. I'm the Western Region Liaison Officer for MDEM. My primary areas of responsibility include Garrett, Allegheny, and Washington counties. One of the biggest topics right now at MDEM, maybe on most people's minds, it's certainly required extensive work by a majority of MDEM staff, has been the FSK bridge collapse. MDEM continues to help coordinate state response to this disaster. Federal, state, and local government agencies, along with the governor's office, make up the response and recovery partners. Initially, MDEM opened the State Emergency Operations Center at its temporary site, which is in Hanover, but later moved it to Unified Command Post located at the Maryland Cruise Terminal, where it currently is now. MDEM has been successful in receiving a Small Business Administration disaster declaration from the Biden-Harris administration, which will allow assistance to small businesses who face losses due to the port being inaccessible. The first one in Baltimore City and the first one in Baltimore County opened last week. I was there the day that it opened up, assisting them in trying to get everything together so that they could get over it. MDEM continues to explore other recovery fund sources to assist in cleanup costs for this disaster. Some upcoming events and exercises. The local support branch is coordinating Fleet Week, which is held in Baltimore at the Inner Harbor. And this year it takes place on June 12th through the 18th. There will be a Peach Bottom Atomic Power Station graded exercise on April the 16th. This exercise includes Pennsylvania state and local jurisdictions, along with state of Maryland, Hartford, and Cecil counties, and numerous other agencies and organizations. This is an annual exercise. The content of the exercise changes every year, but it is an annual exercise. A similar exercise will be held in the spring in Calvert County at the Calvert Cliffs Nuclear Power Plant. And a search and rescue exercise will be held on April 18th on the Potomac River involving Washington and Frederick counties. I believe this was reported on at the last quarterly meeting. This is the first of several planned exercises of this nature throughout the state. April 8th through the 14th is Severe Storms Awareness Week. MDEM will focus on a different type of severe weather event each day by sending safety tips out to the public. And the last event is the Whole Community Integration Summit scheduled for April 11th in Baltimore. Has been postponed until June the 5th due to the bridge collapse. Last thing that I have to report on is an update on the state mesonet system. There are now 8 weather mesonet systems online. Frostburg, Keedysville, Clarksville, Beltsville, Baltimore City, Queenstown, Ridgely, and Easton. There are 2 additional sites, Upper Marlboro and Waldorf, that are scheduled for completion this month. And work continues to meet the first goal of this project, which is 1 site in each county. And with that concludes my report. Are there any questions?
Any other questions for Maryland Department of Emergency? Thank you, sir. DNR?
Chris Robertson with Maryland Forest Service. Starting out for 2024, it's been a kind of a slow start to the spring fire season. A little bit lower on numbers as far as fires go so far to year to date, mainly because, as you can see outside the weather, Has been helping us out a little bit. But we expect that to pick up in April. April is typically our busiest month for spring fire season. So with people getting out and about, cleaning up their yards and things like that, we expect to see fire activity increase in the next month until we start getting full green up, which normally comes the end of May, maybe a little later out in this part of the world. One of the things that we've seen an increase in across the state is interest in prescribed burning. We've been doing quite a bit of that ourselves over the years. With 2023, we had about 9,000 acres burned through prescribed fire. We've seen an uptick in the amount of requests we're getting from local private landowners. So we expect to see that number increase over the next several years as people see the benefits of fire on the landscape, good fire on the landscape. So we expect to see that those numbers increase. And as partners to the fire service partners, we welcome any participation that local companies want to do, help us out with that, get involved in prescribed fire. We welcome the extra resources and the extra hands. We're trying to develop a prescribed fire council for Maryland. It's in the development phases right now. We're selecting a steering committee. We hope to stand that up this year, basically just to advocate for the use of prescribed fire in the landscape and help people who want to engage in that activity do it safely and responsibly. Personnel and staffing, we were fortunate enough to have two of our long-term contractual staff converted over to classified. Those are key positions, one here in the western part of the state and one in the eastern part of the state. Those personnel were key to our operations as far as equipment build-up and maintenance, and they were serving as long-term contractuals without benefits, and just recently they were both converted over to classified, so that was a big plus for us. We also just hired a long-term contractual position to serve as a coordinator for the Community Wildfire Defense Grant Program. That program provides $1 billion over 5 years nationwide for communities that want to protect themselves from the hazards of wildfires. That position will be reaching out to different communities across the state to see if there's an interest in applying for those grants. It is a pretty cumbersome grant application process. There's a lot of things to meet before you can qualify, but it does provide a lot of funding for successful communities. We have not had any applications for that in Maryland for the last 2 years. We hope to change that this year and get a few applications in. Here east of the Mississippi, we're not real successful. Most of that money is going to the west, where you see a lot of more wildfire problems out west. I think there was only 3 projects funded last year in the 20 northeast states. So competition's pretty stiff, but that doesn't mean that we wouldn't get a successful application through. The Volunteer Fire Assistance Program, last year we provided funding in the amount of about $127,000 across the state in 50-50 match grants. We expect to have a similar amount of funding this year to do the same thing. Those application process should start next month, actually, probably in the middle of next month, in the middle of May. You should see those applications coming out to sign up for that program. Some wildfire training things. We completed our safety refreshers and our pack tests for our returning firefighters, which is required for us to send people out of state to fight wildfires out of state. We completed those. We recertified about 100 firefighters, and those are state employees as well as volunteer and career department personnel. So we hope to get people out on some fire assignments again this year. Starting probably as early as later this month. The 2024 Mid-Atlantic Wildfire Academy is once again going to be held at Garrett College, right down the road here in McHenry, June 10th through the 14th. Registration is currently open through the end of this month. There's the basic wildland fire class is open to members of volunteer departments here in the state, and there is no tuition fee for that course for volunteer firefighters, as long as they're a member in good standing. We've been pretty fortunate in DNR and the Forest Service, especially over the last several years, with our budget, especially our fleet budget. We've been able to replace a lot of our fleet vehicles, which were declining significantly. So we've been very fortunate to receive a lot of funding for those vehicles. New vehicles in FY24, which we're finishing up now, are coming in. And then FY25, we did get some funding in FY25 to replace even more vehicles, and we hope to have our fleet down to about a 5-year rotation as far as age on those, and that's going to help us out quite a bit. We just did receive also 2 new tractor plow units. One will be stationed in Frederick County, and the other one will be on the lower shore in Worcester County. Those units were purchased out of funds that we make from sending stuff out of state on wildfire assistance to other states. So the money that we bring in, we don't have a budget for heavy equipment, so that's one of the ways that we can fund our equipment is to send stuff out and make a little bit of money. As you know, you guys know all too well about how expensive fire equipment is. Anytime you put something with the word fire in front of it, it's very expensive. So that's we were very fortunate to get those. We also ordered 2 new heavy cabin chassis trucks, F550s, that will be built into wildfire suppression Type 6 engines. We're not sure where those will be stationed at yet, but that'll give us one in each region, one of these heavy trucks in each region, for in-state use and as well as out-of-state use. A couple of the other things, one major purchase that DNR did, and I think it was in my last report, was we do have a new helicopter. The department was able to get an Airbus H125 A-Star helicopter. It's stationed out of Easton, and it's available statewide. And it did come with a Bambi bucket, 120-gallon Bambi bucket for fire suppression. And it's going to take the pilot a while to get up to speed on the use of that and get certified, but that's something that we've never had in DNR before is air resources for wildfire suppression other than just an aerial platform. So we're looking forward to that. It's going to take us a while again to get up to speed, but we're looking forward to seeing that. And the last thing that I'll mention is the Smokey Bear turns 80 this year. So if there are departments that are looking for Smokey Bear events, I would say get with your local Forest Service office early, because it's going to be very busy throughout the year, doing events throughout the year, and we hope to have something pretty special for the convention this year for Smokey's 80th as well. So again, that's about the end of my report, unless somebody has some questions.
I assume that tractor in Frederick will be at Gambrel. Is that where they keep it?
Gambrel,
Okay.
yes. Yep.
Any other questions for Chris? Thanks
I
for
have
the-
one, Mr.
Nope,
Chairman.
hold, stand by. Go ahead, Mr. President, past President.
I was reading an article recently about the amount of fires, wildland fires in Maryland. It says that last year in 23 was well above the 10-year average. It says in 23, lands experienced 199 wildfires, burned over 4,000 acres. Over the last 10 years, the average has been 127 or 2,000 acres. I was wondering if, and I see that the breakdown about debris burning is the most serious and arson is number 2, but I was just curious if the department is looking to try and do better education or training or something to obviously try and improve on those numbers in the coming years.
Yeah, so we do have what we call our Firewise Maryland program. So we do a lot of outreach through that program as far as making people aware of fire safety as far as defending their homes. But we also do a lot of outreach events for prevention as well, the Smokey Bear events and things like that. One of the things I'll say about the 10-year, the report that you mentioned, is that in 23 we did see a decrease, or it was one of the drier years that we've had over the past 10 or so years. For about 10 years there, which made our average numbers drop. We were pretty wet throughout the state, and last year we we saw an increase in drier days, and that's pretty much what contributed to the higher, higher number of fires and higher acreages in 23. Now that trend may continue in 24. It remains to be seen as far as the way we're starting out. We're starting out, about 4 inches above normal for rainfall for the year so far. So it's looking like we're going to be wetter, but that could change, pretty quickly. But yeah, so we're always trying to do a lot of outreach events as far as fire, fire prevention events. But I'm not going to look at 1 year as far as, we've had this discussion internally for people we have a lot of newer people who think, oh, this was a really busy fire year because they're newer. They weren't around, 15 years ago when we had a lot more fires, or 20 years ago when we had a lot more fires. So that 1 year anomaly, I'm not going to throw it out there and say that, this is going to be the norm moving forward. I think it's just we had a drier year in 23 and we saw an increase in number of fires and acreages. And a lot of that was contributed to a couple of larger fires that we had. On the Eastern Shore, we had one fire that was over 2,000 acres, and that was in the marsh, which is not that uncommon for the wintertime. And then we had the larger Soldiers Delight fire in April of last year in Baltimore County that did increase our numbers. So I think there was a lot more visibility as far as the fires got last year too, which made a lot of people more aware of the fires, especially with that fire in Baltimore County. It got a lot of press. So, yep. All right, thank you.
Okay, EMS committee?
Morning, Mr. Chairman. After I give my EMS committee report, I have an additional report to give the letter that I passed around. On the committee, thoughts and prayers for St. Mary's County Duty Officer Todd Bowman and Dr. Jason Finkelstein, who have flown to shock trauma during a line of duty incident on February the 8th. House Bill 784 and 1143, referencing emergency department wait times and reduced wait times. Transfer times are being tracked and shared weekly with the hospitals, EMS jurisdictions, and the Health Service Costs Commission. HSCC is proposing incentive penalties for hospitals. They are slow but steady progress. We thank President Smothers and SEMSAC for the support in the July 2024 protocol changes. Continuing education platforms are being created. Esmolol 2024 is an additional medication for long cardiac arrest, VT&B, that will be added to the vape ALS formulary, 1 vial per EMS unit. No new recommended devices. House Bill 1092. This bill requires the Maryland 911 Board to establish training standards for public safety, entering point personnel based on national best practices for high-quality telecommunications. Cardiopulmonary resuscitation are specified. The bill also expands the stated purpose of the 911 Trust Fund to include providing funding for any such training. Shortening time for dispatcher to recognize cardiac arrest and move the public to CPR. Dispatch center to keep time data for care records. JAC meeting reviewed video laryngoscopy data supporting the need for these devices. Care needs to be equitable across the state. MSFA will support the protocol to come out of optional status. Reason 3, no conferences here. Conference in Calvert County November 30th of 2024 will be similar to the Pyramid Conference. 911 dispatch will require further training that should not be limited to specific agency. Option available: AHA, HS, Red Cross. Dr. Chismer stated, it all falls under MEMS. Senator Kagan made sure everything was funded accordingly. Next thing, which Dr. Delbridge explained to you, but we got to go over again, is Senate Bill 1099. This bill expands the purpose of the Public Access Automated External Defibrillator Program to include an initiative to co-locate up to 2 doses of Narcan with each automatic external defibrillator placed in a public building. The Emergency Medical Service Board must develop and implement the initiative
in collaboration with the Maryland Department of Health and to adopt regulations jointly with MDH. The initiative must be funded in the same manner as the AED program. The EMS committee does not want and denied support for this program. Reasons why: who will be managing the program? Who will be paying for the replacement of Narcan when, if it is used or taken from the AED case on the wall? Who will be tracking the usage of the Narcan? Will there be a requirement to call 911 if this item is taken from the case? Will there be a training requirement for this? If not, why? Because if you go to the health department to get your own Narcan, they provide you with training before issuing this item. Additionally, they make you sign for Narcan prior to taking delivery. Listen to the hearing that took place yesterday afternoon in the Education, Energy, and Environment Subcommittee of the Senate. They stated that no training will be needed. What's the difference between the public access Narcan and the item being handed out at the health department? Dr. Chisholm agrees with the concerns and will not support initiative without study. My co-chair Gina wrote a letter, which she will read to you.
Good morning, Executive Committee. Gina Panarella, co-chair, EMS Committee. So with Senate Bill 1099, we wrote a letter that was in unfavorable opinion for the co-location of Narcan within AED cases. Some of the points have already been read by Chair Udell. However, the big thing was the management of the program, the replacement of the Narcan or naloxone taken from the wall, and who's going to track the usage. I understand that at the last minute of the 11th hour, MIMS, who was in agreement with opposition for it, wrote a letter to the state, to the senators as well, to be a favorable opinion for it. And at that time, the Maryland Department of Health opted to hire someone that will be managing the program across the state. However, one person cannot manage all the counties across the state nor the location if it's going to go into public access AED. So we did request that a study was done statewide to show the justification for the placement and the public use of naloxone. Most of the time whenever naloxone is used for an overdose, it's not in a location that would be close by to a public access AED. Many of these overdoses happen in places such as private residences, a park, or a vehicle, etc. Naloxone is not cheap, and right now fire and rescue companies are mandated to carry this medication in their bags on all the ambulances, first responder units, and medic units across the state. Additionally, most police departments carry this on their person, which they also have to receive training and sign for their issued naloxone. We do not do enough across this state to combat the opioid problem, and the use of naloxone is just that, a Band-Aid, and not a permanent solution. We would be better served to provide additional mental health or substance abuse programs or resources across the state within the communities and/or hospitals. The MSFA committee is not in support of this and would like an unfavorable voice on Senate Bill 1099. So that was sent over to everyone down in Annapolis as well. So just so that it's aware that we were not in favor of it. I understand that there was a change last minute.
Was that in coordination with our legislative committee?
Yes.
Okay, very good.
Okay. Environmental carbon monoxide alarming device is an optional on the response bags. 2 recent incidents which impact the patient and crew safety are requesting carbon monoxide alarming device not to be optional. They're on the response bag. I've been out on calls when we were not notified that it was a carbon monoxide or they didn't know about it. And these things, the alarms went off. We got out of the building, and we also got additional resources to come in. So that's an important thing to try to get it as not an optional item. Shock trauma, I don't have a report, but it was read. President's letter. The section OSHA 29 CFR, this section contains requirements for the organization's training of personal protective equipment for fire brigades whenever they are established by an employer, specifically how we function as a fire service. Incidents which have a death or injury could potentially result in fines to the volunteer companies. The Maryland State Fire Prevention Commission of which Mark Bilger is a member, is reviewing the proposed changes to include the stop and search and rescue. This will have a huge impact on volunteers. Pay attention as this starts in March 6th of 2024. MSFA Murphy Fire Marshals Mako and Chip Jewell will be served as insurance expert. Mark Bilger asked if the NFPA standards are being adopted into OSHA. President Smothers affirmed. That is my report. If there's any questions on the EMS committee. Yeah.
I do have
Mr.
one thing
Questions,
to add.
thank you.
I apologize. The one thing that was touched on, he said there was no report for shock trauma. However, I do recall from the last meeting, the big push from shock trauma is May is National Stop the Bleed Month. So just kind of keep that in mind as you're out and about within your communities, that May is Stop the Bleed Month. They do offer classes within shock trauma that are available on the website, and they're always looking for instructors.
Further questions? Questions from the board?
I also want to remind everyone that April is National Volunteer Support Month. So I just want to remind everyone that we need to appreciate our volunteers.
Thank you for that. Yes, we do. And yes, we are.
Okay. My second report
Very good.
that I have, I'm only the messenger, and that is all. I'm not involved in any other way. Approximately a week or so ago, I was at the Baltimore County Volunteer Fire Association's Chief Officers meeting, which you all should copy of that also. At that meeting was brought up that Baltimore County felt that there was a 70 to 80% fail ratio in National Registers EMT. At that point, they stated I am the chair of MSFA EMS committee, and it's my obligation to bring it before this body. And I said I would. I did talk to Eric Smothers the very next day after this happened to get all his instructions. I also told the association that they needed to write a letter to Eric, which you all have a copy of, because I believe things to be in writing. What proof did he have other than the hearsay that I heard at that meeting? I also told them I think they should have had a representative today at this meeting to explain their problems. As you see, no one is here. At that point, Eric got the letter. He responded back and forth to the Vice President of the Association in reference to this letter. One of the chief officers had talked to Mark Bilger in reference to this. He was not happy with Mark's comments. That's exactly what he reported, as Mark representing males. And so I'm representing this. Whatever this committee wants me to do, I'll present back. But I did give the link to President Smothers at the next Chief Officers meeting, which will be this month, so he can join by Zoom to discuss this. And I don't know if Eric has anything else to discuss on this. Him and I have been back and forth discussing it. I think he has other issues to discuss.
I mean, the executive board, you guys, you have the letter from Baltimore County, and, you know, I've reached out to their president already. Steve, actually, and both he and Mike addressed that a little bit already. You know, it comes back to folks not fully understanding what I said earlier. I don't think it's worth to repeat all that. Just folks need to understand that when issues arise, we do address them. So whether it goes back to Dr. Delabridge, from Mims's part of it, or Memphrey's part of it, we address all those issues. So when folks say they're having 50% failure rates, 60% failure rates, I don't see that documentation. I don't see that. You know, you got to come up with something better. I realize that they may have an issue with a particular class, but usually once you get into the weeds of that, it's because the students didn't do what they were supposed to do, or there might have been an issue with an instructor. you know, or if it's on a practical examination, when we see a high failure rate, then we address that and see what the issue is. Was it the instructor? Was it the information that the evaluators were giving, or was it the scenario? And we look into that. And that usually goes back to the medical directors or to the directors of Medfree or MIMS, and we figure what the issue is and get those issues addressed. But I think it's disingenuous of folks to say that we are failing here in Maryland with our EMTs, and we're not. So unless there's something that I'm missing, you know, from either here for MSFA or SIMSAC or the EMS board that I'm missing, I haven't seen that. I mean, show me where we're failing. Yeah, we do have an occasional issue with a class or a practical examination, and we address that head on. But to go back and try to say, let's go back and get away from the National Registry, develop our own written tests, and do something different, I don't see that happening. We've already been on that boat. But I will do whatever you guys direct me to do and to address these issues. So, Mr. Chairman, you let me know what you want. I mean, especially while we have the leadership here in the room, if there's issues that need to be addressed, let's address them today, you know, whether it's a practical or written, so that we have a firm understanding of what we need to do.
Dr. Delbridge and Director Cox are both here today. Both have been provided, and I think Director Cox, this is the first you've seen the letter, correct? So those issues certainly I'm very hopeful will be addressed of a particular class or classes. Historically, we've put hours and hours and hours into the evolution of today's EMT program and National Registry. And I think there is a commitment, has been a commitment, to get it right and do what we can. It's not going to be perfect for everybody, and there will be issues, but we do put and have put a lot of time and effort in Eric and the EMS committee and many, many people over the last 5 or 6 years since Dr. Bass left, and we wound up having to be involved in this. There's been a tremendous amount of involvement, and I think you have heard from the president there will continue to be the involvement. We have Dr. Delbridge and Director Cox here with that commitment, and we will continue to follow through. But I think some of the people, I've heard the rumors before today, but this is the first I've seen the letter, so I think, you know, given the opportunity that we now have the information, if there's a specific class or classes, I'm quite sure our partners will get into those specifics, and we want to do what is right and make it right. We're not be able to wave the magic wand today, but I think the president has made it very clear, and I believe the leadership from our partner agencies made it very clear that we will look into it and we will try to certainly address if there are especially if there are particular issues that need to be resolved. Gina?
So just to tack on to what President Smothers said, so as an instructor for MIFRE, I'm held to a certain standard of my students that they have to complete certain material within Canvas prior to testing. So they have to achieve a certain percentage and before they can even test. Additionally, they got to go through a practical exam where they're given a scenario in the practical this is throughout class, where they have to complete and maintain to a certain standard as well. And if we feel that they don't pass on. There are some students though, this class, they're not going to pass. And it's simply because, and I know that President Smothers and I have discussed this before, they have reading comprehension issues and the school system has failed them. Because we have no child left behind, well that's the case, where no child's left behind, and regardless of what happens, they're passed through school. So we have kids with reading comprehension issues, students that come in, adult learners and teenagers alike, where they have reading comprehension issues and they're not going to maintain that and they're not going to achieve that. And it's just unfortunate part of it is what it is. However, with the state practical exam, prior to even the current folks that are in place at MIMS, there have been problems with the practical exam. And not so much the exam itself, but the results. And one of my classes, actually several of my classes, I've received results the day of because they come to the instructor. And I've received results where I'm told a student fails a medical station. Fine, they can go back, they can retest the medical station that day. But then they're like, oh, well, wait a minute. As soon as I get all the paperwork, because we're going to retest them as a group, I get all the paperwork back. Nope, they failed the trauma section. Well, which is it? I had one student from a class that was right before COVID, where the student went through class, finished class successfully, wanted to take a state practical, was told one thing the day of, another thing the day after, and then whenever he came in to do his remediation, was told a completely different thing. So there's part of that, again, this is pre the current folks that are in place at MIMS, that there's been problems across the board. So this is not, if there's a practical issue, it's not something that's current, it's something that's been ongoing, it's just never been brought to the forefront.
Jim?
I think they've got some concerns, but I don't think we have the whole story. We've just got a very brief synopsis of what their problem is, and I think we need to hear from them. Can we pull their numbers from the state numbers and see if what they're saying, because they're saying that their numbers are different than what we're providing. I mean, I don't. I mean, that's just one thing, but I think there's a lot to this that we're not getting in just a piece of paper. So I think we really need to follow up on this to see what the concern is, whether it's an isolated problem, or whether it's something within the whole system. But I think we really need to look at this more in depth.
Mr. President, you're actually going to their chiefs meeting. You said you're actually going to the meeting to discuss with them and try to.
Yeah, I mean, I'm going to attend their meeting, but like I say, I think this is an isolated incident, and we're going to have those isolated incidents, and we address those. I mean, the directors are doing what you're asking us to do, as well as the EMS committee here, and you know, they bring it to our attention, they bring it to the president's attention, and we address it directly with the directors of either MIMS or MIFRI, you know, depending on whose pot that goes into. So, again, it comes back to, I don't want to blame everything on the student, but when we have failures on the practical application side of that, we can see that. There's nothing that I have not asked either MIMS or MIFRI to go back and look at that they have not made corrections. So, and if it was an instructor, MIFRI addressed it directly with their instructors. If it was the scenario that was out of kilter, the medical directors have addressed that. And either behind the scenes, they've either thrown it out, or they've approved it, or say, we're not doing this again, and fix it. I mean, there's a myriad of ways that we can clean things up. But as I've said before, we're going to have providers, whether it's EMR or EMT, that's not going to be successful. And those are the folks that Gina was talking about. But the only way we fix that is through the public school system. And that's a harder nut to crack, but we got to have numbers to back that up for us to go to the Board of Ed and say, hey, we got an issue. So, as you know, when you go do your test, you can't have a reader, you know, and that's problematic for some students. And that's both the adult learner and the kids. So, we're going to see that. I mean, we're not seeing anything different than we see on the operations side for fire rescue. Those issues are the same on that side too. So, I mean, you want to compare apples to apples, you know, you're going to see those same numbers on the other side, unless, so, you know, I mean, we're not picking at the fire and rescue side of things. We want to dig up EMS and say we got an issue, but we see those same things on the other side. So, can't use that broad brush and paint the whole side of the barn with it.
Thank you, Mr. Chairman. Susan Mott, I'm the vice chair of the EMS committee. My concern about this letter is, I am going to echo, but you beat me to it actually, is the fact that the information that was brought in this letter has no confirmation. Not to belittle or not investigate, but at this point we don't really have enough information to do anything about it. I think that the challenge to them is to bring it back not only to this body, but specifically to the EMS committee, so that we can address their concerns. It may be a county issue, it may be whatever, but they need to do their due diligence also to bring the information to us. And I challenge them to do that, and they're more than welcome to come to our committee meeting and bring that information so that we can provide that information to this body. Thank you.
Thank you. By bringing it here today, I think that's been accomplished. The leadership on that side, leadership on this side, everybody knows what's going on. Everybody has a letter. Let's address it and move forward. Just that simple. Any other questions for the EMS committee? Thank you all very much.
Thank you.
The safety committee has requested to go ahead. Mike? He has a commitment he needs to leave. After that, it'll be transportation, Chief Tome and Mitch.
Thank you for taking me early. Glad I brought some warm clothes. I didn't know it was this cold. It could ever be this cold in April. Good God. Thank God for Walmarts. We've had one safety committee meeting since the last executive committee meeting, and it was at the Trauma Center in Baltimore, and they couldn't have done enough for us. The shock trauma team, it was just, we had 29 people in attendance, and the feedback was awesome. We got some really good pictures. Thank you. We got some really good pictures of the MSFA members at the Trauma Center, and Becky and Gilmore and her associates just couldn't do enough for us. And we found that sometimes they like us to be there because they're hearing from the field what's going on in the state, and them being the reactive providers for health and for what happens. I think they like that continuity with us. I feel that way, and they just, so my purpose of telling you that is, if you all need to have a meeting, those who've never been to the new shock trauma or Adams County Shock Trauma Center, they've got a wonderful auditorium in there that will accommodate about 250 people, and it's a wonderful place. If you ever need a place, your parking, you have to pay. It's going to cost you $10 to park in the parking garage behind the old ME's office, but it's just super nice, and I would recommend sometime we do that, just for keeping our bridge with the trauma and MIMS. MIMS is around the corner. Speaking of MIMS, we also went around the corner and did a update with MIMS, the safety committee, and we also looked at the state control center, which is very impressive, and how they're keeping up with telemetry, and they're monitoring the helicopters and the entryways to the emergency entrances of all your different trauma centers and hospitals in this state, which some of you probably aren't aware of. And extreme continuity in there with monitoring what is going on around the state. For instance, a mass casualty incident. So it was a lot of feedback about that stuff. And we had been through, this is our third time, we've been there in about 4 years. But just learning what they're doing to keep up on the MIMS side in the state with what is going on out in the field, whether it's in Oakland or it's in Ocean City, it's crazy what they see. Also, they have 24 hours, they have a sergeant from the state police that is their duty officer, and pretty much everything goes through him in a split second. They have a rule of 20 seconds, which I didn't know about. So if the poor soul gets, if he's in a bathroom, he's jammed up, but if he's sitting there, they have 20 seconds to get to him in all 5 regions of the state. And he calls the shots, whether it's weather related, it's all pre-done, but it's for our own safety while they're doing it. And so, and they actually practice with like a mass casualty incident. So it's kind of neat to hear what they're doing proactively about it. In our meeting, there was one thing that came up which I had never really thought about, and that's with the AEDs in the state. And we had a really good person give a PowerPoint presentation, and in that PowerPoint, he was brought up that some of these units are getting old. And for instance, down where Roger and I live, you've got salt air, and where they're partly energized and where the battery contacts are, he's finding when he goes to replace them, a lot of these units are not working. They're not working right, or they don't offer the amount of joules that you need to do what it does. And also, a lot of these units are not being looked after. Like, for instance, if you put one like in the state or the county highway barn, the state highway office, where they're not being monitored by somebody systematically, you go to use them and they're not working. Or you leave them at a pool, and the pool's only open 3 months a year in Montgomery County, and they close and lock the door on Labor Day, and the thing just sits there in the cold weather, or it sits there in the ambient temperatures like it is right now, 35 degrees out, and they go to use it and it's not usable. So I want to bring that to you. That is a safety concern, especially if you go to use it. So food for thought. It's got to be energized, and it's got to be monitored for it to be able to work. And this came up, we beat it up a little bit. The lithium-ion battery, it's on my third paragraph of the report. We've got a problem in this state. We don't have enough training. Plain and simple. They beat me up. I've gotten a bunch of emails. Some of the chiefs throughout the different parts of the state have addressed it. I don't know what Maryland fire chiefs have done. I did go to the one conference, but it's going to hit us all at one time, and I brought this up before. Baltimore City's getting ready to take an order within the next 2 years of 175 buses. You're going to end up with like 27 buses in Ocean City. You're going to end up, because the governor wants it, you're going to end up with all this. And when you've got thermal runaway and you've got one cell that goes bad, and all of a sudden you've got a compartmentalization that's surrounded by 2 sets of metal, how is the fire department going to put it out? And you're just going to have all these what ifs, and I don't want to beat this up, but I put it in the report. Suppression efforts are going to be really tough, and also you're going to look like a fool when you sit there for 24 hours and wear your people down because the thing's still smoking. And we need to get some really good, we need to get MIFRE to get out there, investigate it, find the best speakers. And there's one that's in Virginia Beach. I went to a special that Worcester County paid for, and get some definitive training in this state before it hammers and hits us all at one time. And we look like, as fire officers, we don't know what to do. Yeah. Okay. I'm just telling you, I'm reporting back from the committee, but I understand that, and I appreciate it. The other thing is about this OSHA standard, and Mike's up here, this new Code of Federal Regulation 1910, 156, it's a new proposed standard. We've got to be proactive about this. I'm not going to sit here and read it, but when you take 400 plus pages of regulation and you drop it on the volunteer fire sector, we are asking for issues that we have never seen before. An example that came from the safety committee meeting was, if they do adopt this, and it does happen, a small department like, and I'll use the example, Elliott's Island, Taylor's Island in Dorchester County, Bishopville and Worcester County, up here, this little town, if they could see that we have not done something that is gross negligence, that attorney is going to go after that fire chief, and he's going to go after that department. And even though we have liability insurance, if it's multiple casualties like what's happened in Baltimore City, we're going to have our hands full. It's going to be another discussion we're going to have, really. So we need to get this proposal. And let me tell you, as a safety professional, and I was certified for years through Nationwide, I love regulation, because regulation is what we use to get these guys, to strong arm them, if you will, and you know that from the insurance industry, is, hey, this is it. Unless you want to pay a big fine, you better comply with the Code of Federal Regulation. The point being is, the volunteer fire service is struggling, as we all know, and if we don't grab a hold of this and try to do what we can to filter this or scrub it, I guess the proper word would be scrub it, and get some common sense in it, this 450 plus page regulation, if it goes through, we're going to have our hands full. And it is going to be, you're going to hear a lot of feedback from the field, from the fire officers, and I would venture to say in 3 or 4 years, it's going to be a nightmare it's going to worry these guys. These qualified people are not going to want to run for chief if we start to get all this feedback from the field that these guys are using this regulation. If it does get approved, you're going to scratch your head, do I really want to be a chief or not? And that's going to be a detriment to the fire service when you got a good person.
We're very much involved in that.
Okay, I know you are,
yeah,
but I'm just laying the what ifs out.
Yeah, we're really
okay. That's good. That's good. But it's going to hammer us, is what's going to happen if it gets approved. New York State Firemen's Association, just so you all know this, have put together a real strong committee. Some of them are lawyers throughout, whether it's from Erie, wherever it's from. I don't know if you were on the webinar or not, but
yeah, I'm with them. They're on the small business committee.
Okay.
That chief, I have their presentation. So yeah,
awesome.
we're working very, very closely together.
Perfect. Thank you. Okay. So, and you do know that the date is coming up. We've got. All right. My question to you guys is this, because I want to give feedback to my people. You don't want to discourage them. Are you, as the administration, and are you guys actively going after the federal people like Andy Harris and people like that to adjust this so it doesn't come back on us?
No, because it doesn't go through federal legislation per se, is regulation. So where we're working is at the regulation level with OSHA, with the Small Business Administration. That's a very large committee. I'll give you an example. We had a chief from Alaska who says they have to fly 4 hours just from some of their firehouses just to get a physical. So the information hasn't gone out as well across the United States as it has in Maryland and Pennsylvania, but it is finally steamrolling. A lot of the municipalities now realize what's going on. The state of New York is very involved. So we are involved almost every other week at the state level, and we are involved about every 3 weeks at the federal level. So who we're after, and there's a lot more behind the scenes as far as why I think this is going to happen, but never say never, never say always. But yes, we are extremely involved. What you're saying, Mike, is being preached all over the state. So we are very much involved.
All right, my question to you is, who from the MSFA has gone through and read all this, every page of this regulation? Has it been President Smothers? You have. So you know it. You know, okay, that's good.
No, I don't know it. I don't know 583 pages.
No, but what I'm saying, you know what's there. You know how it's going to impact us. Okay. Okay. I just don't want it to happen, and you all say, "What the hell's happened here?" So I mean, you know, because you're going to get feedback from it. It's not going to be healthy. Our attorneys here, and I have a feeling for a reason. I'm gonna let you talk. If you want to say anything? Okay. You want? Okay. But it's something we really need to watch, and we really need to be on this quickly. I put on the last page. It's over there. It tells you some references you can go to real quick. If you start seeing stuff coming up, this last page, it's OSHA proposed emergency response standard presents challenges to the fire departments. One last thing, I have developed a friendship with a couple people in Montgomery County Fire Department, and the unions are pushing this. Where I'm getting feedback, the unions like what they're seeing. Now, they don't pay the fines. They're not a county government. They're a union. But it's my understanding Baltimore City is not pushing it. But I will share something with you. We talk about this almost every time, whether we talk about it quietly or we talk about it as the support staff for the state firemen, volunteer firemen. There's a reason why they're pushing this, and I think you know where I'm coming from on not dissolving the volunteer fire service. They're putting more stress on us. So we really, really need to be queued up. And I talked to President Smothers about this. Enough said, but we've got to keep an eye on this. So, what's that, sir?
No, it's not.
Yeah, and go ahead.
So, not to beat a dead horse, because we all know that this is bad. When I've reviewed this, one of the things that's really stuck out to me is that OSHA is misinterpreting what a volunteer is in their documents, and they are underestimating the number of people who would be true volunteers that would be affected by this. So I don't know the extent to which we're going to be offering official comments to this, but I would, when it gets done, I would like to see that the scope be addressed along with any of the other issues so that they understand just how many volunteers will be
The
affected.
one big thing, Mike, that they have totally missed in the proposal is the budget aspect they're predicting is $100 million nationally. I told the OSHA representative that was on our last conference call, who was one of them involved in this presentation, I said, that may be able to cover the state of Maryland. I said, you're about $2 or $3 billion off. They have no idea that the true effect of this. And I think that's where they're going to get caught, because if you go to page, like it's 553, it says the statewide, the national effect's 100 million. That's all.
Well, it's,
They're way underestimating us and have no idea what's
How did
happening.
they respond to you?
Yeah.
How did they respond?
For us to provide information
Okay.
of the, which we're doing.
So you just said it in what you just said?
Yeah.
Okay. All right, I just, the last thing is, NIOSH is getting ready to come out with a report in the next week or so about the second major two firemen killed in Baltimore City. I asked them to come over to the trauma center and talk. Their attorney for Baltimore City stopped the speaker that was coming. The reason why the NIOSH report has not come out yet, it's going to hit the newspapers, the Baltimore Sun, the Washington Post. It's going to hit it big time. You're going to see it. I would suggest that you read it. When it comes out, I'm going to make copies for the safety committee. I'll bring them back for the next executive committee meeting in Ocean City. But we need to look at that. I think what's going to come out of it is too aggressive in firefighting. I think that's what's I think you're going to need to look at the building and realize you don't belong in there, or what is your purpose of trying to put out a fire? It's got no value to the building. And not doing different things like we do the 360s. But I would venture to say Baltimore City is going to be impacted with a substantial fine out of this. Lessons learned, because they didn't learn the first time. So, and again, it's not buying equipment, it's not spending $100 million. It's going back to true common sense before you expose a fireman to a hazard that you shouldn't have been in the first place. And enough said. So.
Any other questions for safety? Okay, thank you, Mike. Thank both Mikes. Let's see. Representative from Grantsville, are we close to, hold on a minute, Mike, Wayne? Are we ready for lunch? Looking at, somebody to check to see, I don't want to get into something and we need to break for lunch. Wayne's your quick report. You got it. Go over to the drive-in and grab a bunch of burgers.
Good afternoon, everyone. The Transportation Committee been working on the tag research, as everyone probably knows. We're about 65 to 75% of the way through. About 24,000, a little north of 24,000 collected now. We anticipate another 6 to 8 once those folks on the mid-shore and upper shore and Washington and Frederick got started a little late. Once they start to come in, we anticipate, getting the whole so that we can get all the database in and, clean up the loose ends. There's been some tag paint failures. So if anyone has any tag paint failures, tell your folks just get the VR 124 filled out, hopefully with a picture. You won't get your number back, but tag replacement will be no charge. We're going to look at getting with Jonathan for a marketing to get some more tags out there in the trumpet. And the old logo tags, we're going to come up with a little flyer that people can print off. If you see someone with an old logo tag, give that to them so that they can get their new logo tags to try to get those cleaned up as well that are still hanging out there that haven't been replaced. So if there's no questions, that's all I have.
Any other questions for Chief Dunn? Thank you, Wayne.
Yes, sir.
Well,
Well, they have to submit the $10 and research, but if they fill out a VR 124 and submit the $10 to their coordinator and go through the chain of command to the office, they'll get their tags. But what I referenced in the beginning is that there's some failures on paint, even of the new tags. If that occurs after they've paid their $10, there's no charge for failure of the paint for the new tags that are coming out because they've been deteriorating.
Yeah. Okay, Randy? Anything else for Wayne? Thank you, Chief. Mitch, anything on the president's car? Okay.
Mr. Chairman, I got it.
Mr. Steve?
Got a call yesterday from Plaza Ford that the parts are in to repair MSFA 4, the executive director's vehicle. We're going to be making arrangements for that, and also while it's in for that repair, the emergency equipment will be installed, the radio will be installed, and also she may be without that particular vehicle for a period of time, and we will probably have a rental vehicle.
Thank you, Steve. Anything else for President's Car Committee? Kevin, do you have a report on anything on the fire police? Is that a short one?
It's a short one.
Okay, this is a short one, not at all.
Yeah, it's short. Like I say, we met on February 24th down at the State Highway Complex in Hanover, Maryland. We got to take a tour of their facility down there. We got a lot more input on Chart's doings. Our committee is starting to build. We're looking for somebody from Garrett County, Calvert, Charles, St. Mary's County, Kent, and Caroline and Somerset. I am working with a gentleman now on Cecil County. We found out while we was down there, Anne Arundel and Queens Anne County does not use fire police. So our next meeting is going to be on May the 4th, and that's going to be down at the Carroll County Training Center. And what we did, we sent a survey out to the committee members. We're trying to set a standard just for the equipment to start out. So we've got all them back. Me, Bob, and we're meeting on April the 20th to go over this survey that was sent back to us. So hopefully we can get all the equipment, you know, what each county uses, set a standardized for equipment. Let me see. Oh, and also during that meeting, the committee suggests that we pick alternates from each county that has fire police. That way, if the main member can't show up, then that alternate would be able to come and have the input also. But that's the only time that an alternate is going to be able to do anything, is if the main committee member is not there. So we're working on that. For most, all the counties that we do have an alternate. I think the only one we haven't got back yet is Allegheny. So, but other than that, you got anything?
From our meeting at Chart and the State Highway headquarters, we had the opportunity to meet the director of the Office of Transportation, Mobility, and Operations, which handles Chart and all the training for the TIMS programs and stuff for the state of Maryland. And I'd like to make the recommendation maybe that we look at bringing them on as a partner like we do MIFRE and MIMS and all the other agencies, because our people are on the highway all the time, and through Federal Highway with the training, you know, that they want everybody in the state to have the TIMS training. And Kevin Fox from Frederick County, which I know you know very well, Chip, is now the director or taking charge of training, doing the TIMS program. Matter of fact, I got Roger set up so his people down in so Kevin can get down in Worcester County and do the TIMS training. So him and Kevin, I would they would be willing to build a partnership with us. So,
Bob had mentioned this earlier today, and we'll talk to the incoming presidents to add the state highway on as one of our partner agencies to report, particularly with respect to the fire police and the training. So that'll be undertaken by the new chairman and the new president as of June. Thank you, Bob.
right. And also, while we're talking about that, through our TIMS training, we're looking at federal highways recommending that we do set up TIMS committees. So I've been in contact with Kevin Fox about that, and we talked about maybe starting one in the Frederick Carroll County area to see how it goes. Start small, and then we can build out throughout the rest of the states where we can have Tim's committee and get these people all together before we actually get on the highway. So, and I want to also thank President Smothers and also the legislative committee for their good work on getting the two light bills through down there and to the governor's desk, and let's hope the governor now will sign that light bill.
Yeah, light bill I think is going to be good. That green light is fantastic. I tell you, big difference. Anything else for any of the transportation committee teams, Bob? What else?
One last thing. Through Federal Highway, they just updated their MUTCD regulations, and that pertains Chapter 6I pertains to anybody that's on the highway working or like our fire police. So we're going to try to get copies for them for our committee.
And one more thing, Chip. Frederick County, I just set up a TIMS training for all Frederick County fire police because that's been a requirement. There has been some new ones. Now, Kevin Fox told us that last Saturday in Frederick, and that was a new program that they just started. We actually got the very first class of that new program for TIMS. So I got a lot out of it. It wasn't, before the old one, it looked like a 1930 film you watch. But this is all up-to-date stuff now. And, so it is a good program, definitely good.
Yep, safety is a priority for our personnel, especially on fire police. I mean, that highway safety is a big deal, and appreciate you guys really taking it on. Any other questions? Thank you all very much. Have something
just
else?
one last thing to bring up. We track the line of duty deaths on the highway. As of April the 2nd, we've now had 13 responders killed on the highway since the first of the year.
Yeah, it's a major issue. So keep it going. You're doing a great job. Keep it up. Thank you. Okay, we'll be breaking shortly for lunch, but in the meantime, Rob Muller would like to introduce himself and tell you what he's looking to do here in the very near future.
Can everybody hear me? Talk louder than that? There we go. I can hear myself. That's good. So good afternoon-ish. My name is Robert Muller. I'm seeking the candidacy for office of Second Vice President of Maryland State Firemen's Association. I've been a 27-year volunteer with Singerly Fire Company, third generation family member to do so. In those 27 years, I've served as an officer and committee member on numerous fire, EMS, and administrative committees and positions of 25 of those 27 years. I've had the pleasure and honor of serving the county association, both as committee chair, project chair, and vice president, as well as vice president and president of the Hartford Cecil Volunteer Firemen's Association. I've spent a lot of time as an educator, both at the Maryland Fire Rescue Institute as well as community colleges across the state of Maryland, and spent the bulk of my time not only in fire suppression but also in EMS. As we look forward to moving in the coming years, there obviously are a lot of issues that we've been working on as a group, from recruitment, retention, marketing, connecting, growing, and leveraging our partnerships with our state partner agencies. And we've seen what great work that can do in working together to accomplish and respond and support our constituents. So it's my goal to continue that trend and work with our team, starting with our past presidents, as well as President Smothers, incoming President Skip Carey, and Charlie Simpson. Taking the opportunity to really try to connect and reach as we look at the next generation initiatives, the recruitment retention initiatives, and how do we dovetail these together and working and leveraging, as well as our state partners, to get our message out, to recruit, and really make a difference to our community partners. Working to establish and grow those opportunities, a lot of those are within my strengths and expertise. You've heard a lot of conversation about education, connecting people, potential regulation changes, and those will all need to be addressed and worked as a community together to be successful. So I look forward to that opportunity and to serve you as the association in that role. So I appreciate the time today and enjoy the rest of your weekend.
Any questions for Rob? First off, congratulations for stepping up. Thank you. And of course, you may have competition, but we feel fairly confident. You never know. Never say never, never say always. But congratulations for stepping up. We greatly appreciate it. And if there's anybody has any questions, we'll be around a little bit on this afternoon.
Right.
Okay. Anything else? Anything else that has to happen before we adjourn for lunch except the raffles? Okay, raffles.
Like I can.
There you go. There you go. I'll help you out.
Thank you. No. First of all, I want to thank you for your donation. Now, granted, Teresa and I have both blue tickets. My ticket has the numbers on the end, not across it, but on the end of it, okay?
One, 3, 2. 755-132. Going once. 755-132. Going twice. You're out of here, Brooks. Guess we'll do another one.
Okay, we'll try this again. 755-954. And I forgot to tell you it's $155. 755-954. Jonathan. Yes, I did.
All right, next up. Gene, can you do the Bessie Marshall one? Bessie Marshall. So next we have the Bessie Marshall. We made $185. Thank you all very, very much. Blame Gene if you don't win. Okay, not today. Okay, so 414-2418. Is it you? 418? Bill? Okay. Now, you can do the sun catcher, second place winner. Thank you, buddy. So the next one is 414-2238. $2238. Is that you? Sam? Okay, here you go. Again, thank you all very, very much. And Lori says thank you.
Right for lunch.
Anything else, Mr. President?
Huh? I'm good. I'm good. I think it's John's on. I don't want to be
Steve,
between
we ready?
anybody and the food, so.
We ready, Steve? Okay, good.
Yeah, they're
Okay.
ready.
Chaplain. Okay, hold on. Let's have a word of prayer.
Please join me in prayer. We have the following prayer requests. Patty Thomas has cancer. She's in rehab. Marsha Roth, past president LAMSFA, is having her hip replaced on April the 16th. Sharon Owens is having her hip replaced on May 30th. Dwayne Frost from Laurel Volunteer has a LVAD installed. Yeah. And Harper, who is Donna Struntz's granddaughter, and is in need of a heart. She's up in Pittsburgh. And Darby Bird, past president of Ladies Auxiliary, is having her knee replaced this week. And Charlie is getting his hip replaced on the 10th. Please join me in prayer. Almighty God, we are so blessed to have this morning together, Father, and to have the work that's been done by the committees, Father, and our partners. We just thank you for all the activities that have been taken care of. Father, now as we take time to break bread together, we ask you to bless this food, to bless our bodies as we continue to serve you. We ask this all in your Son's name. Amen.